Good, 12 o'clock noon. This is Tuesday, July the 21st. The Cypress-Fairbanks Independent School District Board of Trustees is now convened in a special called board meeting on Tuesday, July 21st, 2020 in the boardroom of Cypress-Fairbanks Independent School District Instructional Support Center located at 10,300 Jones Road, Houston, Texas at 12 p.m. This special call board meeting is to consider modifying the 2020-2021 approved instructional calendar and to consider giving the CFISD superintendent authorization to proceed with purchasing certain PPE items in response to COVID-19 pandemic. During the course of this meeting, the board may determine that a closed session is necessary. In that event, the board will meet in closed session to consider matters duly posted for this meeting as permitted by sections 551.071 to 551.084 inclusive of the Texas Government Code. We will now proceed with the public comments. Public patrons who have duly registered per policy BED local may address the board and make public comments on an agenda item during or before the board's consideration of the item. The board may allow public comment on agenda items at all meetings. The board will continue with the remaining agenda after the registered patrons have had an opportunity to speak. Presenter is Leslie Francis, and we do have some people speaking. First up is Deanna Parmenter. Did I say that right? Yes, is that okay? Or did I really mess it up? Okay. If you will come up over here to my right, to your left, and there is a microphone there, and there's 3 colored bulbs there, and the green is when you start, and you are given 2 minutes, and at 30 seconds before the end, the yellow comes on, and when the red comes on, please go ahead and summarize, okay? You can take your mask off up there. Ready.
All right, sir. Thanks for letting me speak. I know you guys have some tough decisions to make. I'm here on behalf of my granddaughter, who is in life skills at Woodard Elementary. Her brother has ICS in the regular Gen Pop classroom, and it did not work last spring. Life skill. My daughter is a special ed teacher, or she was. She went to SFA for that. I helped her 2 days a week, and it still was not working. The teachers helped however they could, but the life skills students, it doesn't work in the home environment. And if my daughter, who's a special ed teacher, can't do it, can you imagine what the other parents went through? So I left some copies of some things with this lady over here. There was a New York Times article yesterday that had some good suggestions I just wanted to bring to your attention. And I have 4 questions. If I run out of time, they're on there. But if you have immunocompromised children, how do you address that? If you have a hybrid of situation, how can you give a life skills student the best opportunity under the laws where they need a fair and appropriate education? If the child takes a special ed bus and they're in a contained life skills class, does that reduce the exposure to where the life skills students can attend on campus, even if the other kids are doing a virtual or a hybrid approach? And if a special ed child has to be at home, what safeguards and additional resources can be put in place to assure that they get the help they need? Because I've talked to PPCD parents and others, and we need help, folks. We need help with the special ed population. So I appreciate your time, and I hope you address those issues in your final. Thank you very much.
Thank you very much. Hold on just a second. Okay, if y'all hold on just a minute, we'll go to the next person, but we're going to,
why don't they come over to this microphone?
Let's go to this microphone over here. Good, thank you.
We'll just do that.
Okay. And then they can see the light over here. Christopher Ray. Is it Ray or Roy?
Roy.
Roy, Christopher Roy.
Again, thank you for allowing us this opportunity to speak. First, I would like to commend you all on the $44 million technology funding and attempts to bridge the learning gap for our students. However, I'm here to advocate for keeping both virtual and in-person schooling as an option, specifically focusing on low-income families. I do believe that these families are the ones that are going to be greatly affected by virtual schooling only. Again, I commend you all on the great efforts that were put together as with the spring virtual learning that was put together in the spring, but Cyfair is 54.4% economically disadvantaged. Assuming that there's already an educational gap from the 3 months of the virtual training that we experienced in spring 2020, academically, there is already an existing gap that is dividing the economically disadvantaged students from their peers. My question is Cyfair prepared to fill these gaps and future gaps that arise from a fully virtual learning scenario that is going to be seen in this demographic? A lot of these families do not have the luxury of a stay-at-home parent to be able to focus to make sure that these children are on task and are receiving the help that they need. That's also assuming that this is coming from a two-parent home. Economically disadvantaged families are already paying taxes for their children's education. Are they also going to be expected to pay for childcare in addition to these taxes if needed? If so, this is also begging the question, are we creating a safe environment for our children in the schools, or is childcare a safer environment for them as well? Due to limited time as well, there's a whole list of things we would like to discuss, such as special needs children, which I was glad that was brought up, unsafe home environments that these children may be facing at home, meals, and nutrition. In closing, I would like to say I would like to call Cyfair to action to help decrease the risk for our teachers and become leaders in Harris County. And if we're able to provide ways for our restaurants and our other first responders to be working in a safe environment, I feel that we should be able to provide that for our teachers as well. Thank you.
Thank you, Mr. Roy. Larry Green will come up on this side.
Going to read. First, let me say thank you for allowing myself and others to express our opinions and desires for the upcoming school year. While I could talk in length about this topic, I'll do my best to keep it to 2 minutes. Let me be clear, I believe that COVID-19 is a serious issue, and I'm glad that you are taking the necessary steps to make well-informed decisions that are in the best interest of our students and their families. My hope is that we will make the decisions based on correct data and not on fear. I hope that after this meeting, you will make the decision to keep the schools open and allow parents and students to decide whether or not they want to participate in in-person instruction. I was in total agreement when we first shut down in March. At that time, we knew very little about this virus. It was thought that it was easily transmitted, and the death rate was going to be between 4 and 6%. The death rate is now closer to 1%, and even lower for those who are healthy and under the age of 65. I continue to hear that we must listen to the science about this virus, and the science, the data, so far is telling us that if you are healthy and under 50, you have a very small chance to die from this virus. And while I wish no one would ever die, the hard truth is, with life comes risk. There will be increased cases and possible deaths, but we cannot continue to let fear overrule the data in our decisions. If someone is healthy and under the age of 50, they are at a higher risk of death dying by driving to and from work. If you're under the age of 24, you have a higher risk of being struck by lightning than dying from COVID-19. So far, while it's tragic, only 30 children under the age of 14 have died from COVID-19. In the same time period, 190 children have died from the flu. So if you have a child under 14, they are 6 times more likely to die from the flu. Again, I want our decisions based on data and not fear. Our kids and most employees are not at high risk going back to school. The long-term detrimental health effects of not having in-person school and extracurricular activities, I believe, far outweigh the risk from COVID-19. The significant benefits of school extracurricular activities are well documented. Schools provide learning, structure, routine, socialization, meals, and a safeguard to the overall health of each student. Broad school closures and extracurricular cancellations should not happen. The known social, educational, economic, and mental health consequences are simply too dire to keep schools closed for any amount of time. Thank you.
Thank you, Mr. Green. Tara Cummings.
Good afternoon. I'm Dr. Tara Cummings. I'm a licensed psychologist and licensed specialist in school psychology, and I'm here representing, and a parent of 2 CFISD students. I'm here representing CFISD community advocates for safety and health. We noticed that no one seems to be asking school staff about their needs and concerns during this process. So we're conducting an anonymous survey of our teachers and staff, and thus far 115 staff members have responded. I'd like to share the data with you today. Respondents are incredibly committed to public education, with 70% reporting 11 or more years of service. They are afraid of returning to school for in-person instruction. 64.1% report significant fear for their own health and safety, 72.5% for the members of their household, 75% for their students, 77.5% for the public. As usual, our teachers and staff are more concerned about others than they are for themselves. They will incur significant risk in returning to school for in-person instruction, as a full 50% report that they or someone in their household have at least one known risk factor associated with COVID-19. 80% of respondents report that the anticipated return to school has caused new or worsening mental health and or physical health problems. They feel like an afterthought to the public in general and to CFISD leaders specifically. 55.3% indicated that you have not adequately assessed their needs and concerns for the return to school. 71% said that you have not adequately sought their input in planning and decision making. 60% indicated that you haven't been transparent with them. 65% indicated that you have prioritized parents' preferences over their own safety and well-being. And 64.1% indicated that you have not provided teachers with adequate information and training for anticipated distance learning. As committed as they are, 37.5% are considering leaving CFISD due to these issues. The work our teachers and staff do is invaluable, and their safety and well-being matter. Now that you have heard feedback from them, we urge you to increase communication and transparency with teachers and staff and prioritize their health and well-being alongside other factors and stakeholders, because without them, CFISD is nothing. Thank you.
Thank you, Dr. Cummings. Justin Ray. Over here? Yes, sir.
Well, good afternoon. Over the green?
Yes, sir.
Over the green.
As soon as you start. There you go.
Well, good afternoon. My name is Justin Ray, graduate of Cypress-Fairbanks ISD, former mayor of Jersey Village, and current candidate for state representative. But more importantly, I'm the husband of a special education teacher and the father of 3 rambunctious Cypress-Fairbanks ISD students who have successfully conquered our home. I'm here today to thank the board for its leadership and its thoughtful approach to ensuring our districts keep its promise of delivering a world-class education to all of our children. Texans are known throughout the world for doing the impossible and inspiring future generations to go further and to reach higher. But unfortunately, of late, it seems impossible to separate politics from the pandemic, which is why I think it's important that we as a community remind ourselves that our children are watching, and why as a community we must come together to safely get our children physically back in school. Not too long ago, Texas was in a much better place when it came to this virus, and it's not unreasonable to think our state won't be back to near or close to those levels by the time school begins, which is why it's important to plan now. The CDC, the TEA, and the American Academy of Pediatrics have provided guidance and key principles to opening schools safely. But to get there, we as parents and residents must do our part to slow the spread by following all the safety guidelines. So by doing this, we can lead by example for our children while showing them the importance of communities coming together to solve difficult problems. By providing an in-class option for the Cy-Fair community, we can demonstrate leadership and resolve in difficult and uncertain times. Thank you very much.
Thank you, Mr. Ray. Carol Campbell.
Thank you for allowing me to speak. I am a 20-year employee of the district. And I have a husband who has kidney failure and is on kidney dialysis. I also have a daughter who's a 7-year employee of the district. She's a teacher. She is pregnant with her second child and is due in January. We don't know what this disease is going to bring us years down the road. It's a brand new disease, so we don't know what the impact is going to be on children. And I do appreciate all the comments that have been made. But I'm 60 years old, and I don't know that I want to die in a Cy-Fair classroom. And I don't know that I want to bring this disease home to my husband. I don't know what's going to happen. We have not sent out the survey yet, so I know we don't know how many children will want to do our parents will want to do in person or online. But say most of our parents want to do in person. What are we going to do if we have too many kids in the building? I can only speak for our classrooms, but currently they hold 30 students, and they are literally shoulder to shoulder. We don't have desks, and I'm a middle school teacher, by the way. We don't have desks, we have tables. They are literally shoulder to shoulder, sitting at a table. If half of them want to show up, that would be okay, or less than half. We can separate them with the divider, but if more than half of them show up, there's just literally no space. And as a middle school teacher, I'm concerned about how are we going to let them pass in the hallway? What are we going to do in the gym or the cafeteria when they literally cannot keep their hands off each other now? And if a teacher gets sick, we don't have subs now. Before we had COVID, we couldn't get subs in our building. So if a teacher gets sick, where are you going to get a sub from? And as a middle school teacher, if a child gets ill, is it just that classroom that shuts down, or is it every class that child's been in? I think we have a lot of unanswered questions, and I would really like to see those addressed. And I speak for many teachers that have that concern. Thank you.
Thank you, Ms. Campbell. Nikki Cowart.
Dr. Henry, President Covey, esteemed school board trustees, I am no stranger to this room or this podium. For the viewing audience that may not know, my name is Nikki Cowart, and I serve as the president of the Teachers Union. Cy-Fair American Federation of Teachers represents both teachers, paras, police officers, school nurses, bus drivers. AFT was the only employee organization present in Austin last Friday pushing Commissioner Morath and the TEA before their latest announcement. We are beyond disappointed that TEA continues to ignore science, putting us all at risk, all while they work remotely, I might add. The constant changing of the rules by TEA has done nothing but add an additional layer of stress for everyone in our community. However, the good news today, elected school boards have the power to delay the first day of instruction so long as the district meets the 75,600 minutes. Like all of you, I've been flooded with emails and phone calls. Some are Cy-Fair teachers that are fighting COVID-19 at this very moment. Many others are wrestling with telling their principal or supervisor how terrified they are to go back on campus in August for professional days. What is a reasonable expectation for the number of students per class if and when in-person teaching resumes, and how will we adjust for the known substitute shortage we already had prior to the pandemic? Our union members are not only your employees, most are your neighbors. Many are also parents or grandparents to Cypher ISD students. That would be my only critique here today. In a time such as this, involve workers, unions, parents, and all planning, and do it early. Each community faces unique challenges related to COVID-19. In our Hispanic community, our largest student population are being disproportionately impacted by the pandemic. What is our plan to adjust these disparities as it pertains to schools and zip codes with high incidence of COVID cases? Our union is committed to aiding in the planning of reopening safely. Our teachers are really in need of some strong communication, reassuring us all that concrete steps are being planned for the day we will eventually be back on campus. We did our own survey around school reopening, and I've emailed you all the results. I'll end with this. In the words of the late, great civil rights leader John Lewis, right now, my job is to protect the middle class and working families of this country from some devastating ideas.
Thank you, Ms. Cowart. Christina Woods.
Thanks for providing this venue today for us to speak about this really important issue. I'm a parent of a student in Cypress ISD. I'm also associated with Dr. Cummings, who gave you kind of an early look at the data coming in from the survey that she's working with. In 2017, I came to the school board meeting to address the school board about gun violence in schools, where it seems the onus is on the teachers, administrators, and students to protect themselves from firearm violence. I asked you at that time to implore the state to pass gun reform that would end this epidemic and keep our students safe. As we know, nothing there has changed. We see more policing, millions of dollars worth of policing, but still the onus is on students and teachers and administrators to protect themselves from gun violence. So here we are again with another epidemic. It's a dangerous epidemic that we know very little about. There is data, but the data develops daily with regards to children. Children have not been in school or daycare for the most part since early March in most states. This virus is threatening our way of life and certainly threatening whether it is safe, threatening children and administrators and teachers and the safety of being in school. This is an insidious epidemic, just like the epidemic of gun violence. What we know about the epidemic of gun violence in schools is that it is virtually non-existent when children are not in schools. There's no way for them to be injured or shot when they're not in the classroom. So I'm asking that you listen to teachers, that you listen to administrators, paraprofessionals, bus drivers, everybody that's involved in taking care of our children, so that you all can make the best decisions as you begin to reopen school. Clearly, it looks like being at home for many of us is going to be safest, and I ask that you really look at what disadvantaged children need as well. Thank you.
Thank you. Brian Scott.
I'd like to thank you for allowing us to speak. I'm a parent of 2 Cypher students, and I just want to make sure that you guys are in full awareness that there are parents out here who really want our children to be in school coming, in the next few weeks. I know there's fear, I know there's uncertainty, but there's risk in life, and there's been diseases before this that I don't ever remember schools being shut down. So I think it would be tragic if we don't start schools. If the faculty has issues, understandably, maybe we can marry the students or parents who have problems with going to school with those faculty members that don't want to go to school. But I'm speaking for a parent. I'm a parent that I want my kids in school learning. I think it's devastating to have them not in school. And I would like you to think about some of your fondest days in school when you were younger. If your senior year in high school, you were shut down and not able to go to school. I think that's just tragic, even given the disease, which, I believe is overblown as far as the danger that exists. Even though people are dying, I get that, but it is overblown, in my opinion. Thank you.
Thank you, Mr. Scott. I believe that was the final speaker. I did overlook saying that our Community Leadership Committee, we have two of the members that meet on a monthly basis. Stacy Anderson, would you stand? And Ryan Irving. Where's Ryan? Ryan Irving was here. Okay. We appreciate y'all coming. Thank you very much, and thank you for serving on the community leadership. And now to the reports portion of the agenda. The administration will provide an update on reopening of Cy-Fair Independent School District. Dr. Mark Henry.
Thank you, Mr. Covey and trustees, and I am going to take off my mask just to speak, and then I will put it back on as we go to other presenters. We are going to provide you with a proposed reopening plan for CFISD today, and certainly of the 9 speakers you heard from, that's a great reflection of the kinds of emails and direct messages we get via social media. And I'll just tell you right up front, there's no good answer. If there was a good answer, if there were an easy answer, we would lay it out for you and everybody would be happy. But there are no perfect answers. I will say to those of you who are concerned about safety, and again, I go back and you can look at these board members and you can look at my 9+ years here. I think you can go through Harvey and you can go through other flood events and you can go to last March and you can see that this board and this administration has always cared about the safety, not only of our students, but of our staff, and we always keep that first and foremost in our mind. We started a reopening committee more than 3 months ago, and as you might imagine, or as I know you're aware of, there have been changes every day. We meet every week, and every week there are some new little caveats that we have to deal with. Back in June, when things looked much more promising, people were saying, why don't you survey? Well, the reason you don't survey in June is because it's 2.5, 3 months from when school's starting. And as you might imagine, if we'd surveyed in June and then surveyed 4 weeks later, the survey would have been much different. So we've been trying to wait for our survey till we get a little closer to when school is scheduled to begin, and we will start our survey in about a week. So just so everyone is aware of that. The 2 options that you've heard us talk about are virtual or remote learning and in-person learning. I can tell those of you who are concerned about our virtual platform that it's much improved. As a couple of people stated here, this board has made a commitment to purchase 75,000 devices, and we're going to have much more synchronous learning, which means it'll be actual time learning just like you're in the class, along with asynchronous learning for those who choose a virtual platform. And then the in-person, whenever we get to that point of having in-person school, this board has already voted to make many improvements, and you're going to hear from the committee in just a little bit about specific improvements to our campuses as far as safety is concerned. As you have all stated today, and as I have heard, there are differing opinions. If you talk to local, if you talk to state, if you talk to federal, if you talk to international researchers and medical communities, whoever is trying to support what they're trying to tell me uses the survey or the research that supports what they're trying to say. But there's all kinds of opinions out there, and I know Nikki or someone said there's lots of things we just don't know. We do receive your emails, and I can let you know, those that are watching, and we've got a record attendance for our board meeting, I've been told, that are watching today. Your emails are all delivered to the board. They receive every one of your emails, and they read those along with administration. I'll go back to what I said. There is no good answer, but some of the things that we're going to talk to you today as a board and those that are in the community today are about tweaking our calendar a little bit and we'll be talking about that in a little bit. We're going to be sending questionnaire to parents to see what they prefer when it comes to virtual versus in-person learning. But one thing that we wanted to do before we surveyed our parents and before we sent our employees a questionnaire is we wanted to provide you with what our safety plan is, but not only what our safety plan is, what our virtual platform is going to look like, so teachers and employees and parents can make an informed decision. What you'll hear in a little bit, but I'm going to go ahead and say it just because I need to say it to make the point I want to make, is we are going to propose to the board this evening to move our start date to September 8th, which is the day after Labor Day. The reason for that is that gives us a little more time to get some of our devices in that we have ordered to make sure that we can meet the needs of those parents who choose to use the virtual platform for their students. It also gives, from a scientific standpoint, hopefully we have peaked and we will see a decline over the next 3 or 4 weeks, so parents will feel more comfortable if they choose to send their students back to school. If you, I'm sure you haven't seen this because I literally got it an hour before I got here. The UIL, which it oversees all of our activities, has restructured their calendar for 5 and 6A schools. All of our high schools are 6A schools, so they're backing up football, volleyball, cross country, marching band, all of those things in the fall. But they still plan on playing a full season. It's just going to be backed up, but it's after Labor Day. So it kind of fits, our proposed starting time fits with the UIL calendar, which, I understand activities being very important. Academic is the most important, but those things that we do, that we have a passion and love, those are still the best memories of my high school days. Then we would start our phasing of in-person at that point. And again, Ms. Hull is going to talk to it a little more detailed, along with some others. And as I said, we'll have time to receive devices. We know, and guys, our virtual platform is going to be 10 times better than it was in the spring, and I know many of you are glad to hear that. But there's nothing that replaces in-person instruction. The relationships that are built between students and teachers, we value our teachers. They are important. We have over 8,000 teachers in this school district. And then we have close to another 8,000 employees that support those teachers, whether they be bus drivers, custodians, food service workers, administrators, instructional aides. But we know that those relationships are important. And we can provide schooling online, but it's very difficult to provide an education online. Education comes from what you learn from in-person instruction. But we're dealing with a once-in-a-century pandemic, so sometimes you have to do what you have to do. And I just end with this. Although this school board's made a lot of great decisions, a lot of decisions that the board gets blamed for, and even I get blamed for, are really outside our control. We are subject to federal laws, we're subject to state laws, we're subject to county orders and the like. So it's not always the school board's fault when you don't like something. Sometimes we have to do what we are legally responsible to do. But I promise you, we're going to look out for the safety of our employees and for our students. We know there are many employees and there are students that have compromised health, and we're going to look for ways to make sure that we take care of all of our employees. And I would say just like we have in the past. So that kind of being a lead in, and I know I stole a little of her thunder, but she'll give much more detail. I'm going to turn it over. Ms. Hull, Chief of Staff, she chaired our reopening committee. So Ms. Hull, I'll turn it over to you.
Okay. Thank you, Dr. Henry. I do want to share a little bit about the reopening committee. As Dr. Henry indicated, this committee began meeting in April, and we've been meeting once a week. And when the committee convened, our initial charge was really just trying to guess at how we thought reopening the district may look come August. And we started with the process of really developing operational checklist. They were not details really behind how this was going to happen, but areas that we knew we would have to address when the reopening did occur. We started looking at if we were able to reopen our school district with all of our students, and what would that look like? What are the areas that we would need to address to ensure that we had enhanced health and safety protocols in place for both our staff and students? We began that process of developing protocols with the support and guidance and direction of our Director of Health Services for, what will we do for screening staff? What will we do for screening students? And this was long before we ever received any guidance from the state. We started looking at our facilities. What would we need to do to prepare our facilities in order to make them as safe as possible for staff and students? We began first with our non-campus-based facilities. We knew that many of those individuals and employees were likely to return before our campus staff did. So we had all of our directors begin that evaluation of looking at their individual office spaces. How can we create as much physical distancing between our employees? What modifications would we need to make in those facilities? What type of signage and restrictions would we need to put in place for conference rooms, for high-touch surfaces, for meeting space? How can we reduce the congregations of large group of staff members? We looked at other areas as far as, could we consider relocation of staff to those spaces? So once we began that, then we started focusing more so on our campuses, and we started looking at operational plans for traditional, having everybody. We looked at if we remained in a totally virtual setting, knowing that there were significant improvements that needed to be made in that area because of just, how quickly we had to pivot and begin providing instruction to 118,000 students with no planning, no preparation, just immediately implementing. And I think our teachers, with the support of our curriculum staff and trying to get that set up and going, did an amazing job. In addition, they immediately pivoted. Our nutrition services team, not even one day was missed, and they began to get things up and going and operating with all of that staff reporting to duty beginning March 16th. We've provided over 1 million meals to our families since this pandemic started. Our maintenance and operations staff continue to provide deep sanitization of all of those areas and helping us to, again, evaluate our facilities and looking at cleaning and trying to get hand sanitizers, getting all of those things in place. And that was in the virtual. Our curriculum and instruction team immediately began the process of trying to research and determine the best virtual platform we could find. We knew that even if we were allowed to reopen with all of our students, that there was going to be a need to provide virtual instruction for students that may be unable to attend in-person instruction, our medically fragile students. Again, not knowing what the rules and guidance were going to be from the state. So they have quickly did that. They did that so that we could implement that for summer school, be able to test that, work out kinks, begin the training of our staff on that platform, and they did that. We also looked at a blended. We decided, okay, what could that look like if we have some in-person instruction, some remote instruction? What would that look like? And again, operational checklist. So we really kind of had to sit and wait. And again, all of that work started in April. It wasn't until the beginning of July, end of June, and then the first week of July that the state provided any information or guidance to us about what possible reopening of school districts would look like. And so that is really when the real work began. That is when once our core reopening team, which consisted of key staff in the areas of school leadership, maintenance and operation, transportation, nutrition services, health services, communication, of course, and then in our emergency management and our curriculum and instruction. So once we had kind of checklists, then we knew that we could start, and we knew what the rules were going to be, what we thought they were at that time. That's when we invited staff, students, and parents to join the committee. We have teachers, we have paraprofessionals, we have students, and we do have parents that are providing input. So from that guidance that we were provided, we began trying to put the details behind those checklists. For any of our staff members that are watching, all of those checklists are still currently posted on the intranet. There is a reopening toolkit. You can see many of the health and safety protocols that have already been developed and that are there. So there's been quite a bit of work that has been done, the entire spring and summer semester. So let's fast forward to where we are now. Since July, there have been multiple changes, as you know, in the guidance and requirements for schools reopening, and that's created a lot of confusion. As Dr. Henry mentioned, there are many school districts that surveyed early, and then that data was not even relevant come reopening time because the pandemic, the situation in our community changed significantly in a short amount of time. So we decided we needed to pause and we needed to wait because we definitely had time on our side. The one thing that complicates a lot of the different plans that you're hearing out there is school districts across the state have different start dates. There are school districts in the state that start as early as next week, the end of July. They're districts of innovation, and they have modified their school start date, and they start early. So when the state did not release guidance until the beginning of July, there was panic. How do we quickly develop a reopening plan, and we're just now getting this guidance? So there were some changes that came later from TEA to provide them a little bit of flexibility, and I'm going to get into that. In our own local area, we had school districts that modified their school start date, and they're starting as early as August 6th. So they didn't have time on their side, so they had to quickly release their plans and get that information out there. And I know in the absence of information for many of our employees and teachers, you kind of start assuming and thinking that we're not listening, hearing, or planning. But we've tried to not be reactive. We've tried to be very thoughtful about the plans that we're developing to really solicit information, solicit feedback, solicit input. The plan that we're sharing with you today is not at all final. We're learning that nothing is final as we navigate through this whole crisis. This is really the week that we're trying to put the final touches on it. We would like for the board to have the opportunity to ask questions, to give us input and feedback, to make certain that they feel we have addressed all the key areas. Tomorrow, we're scheduled to meet again with our reopening committee at 8 o'clock. So we'll meet with them from 8 to 11. Look again at the feedback that we received today. Are there any tweaks, changes, adjustments, additional areas that we feel we need to address? And then in the afternoon, we're going to meet with our Community Leadership Committee, which again is a group of very engaged, active community members. They're not employees. They're a combination of parents and community leaders that stay very engaged and active in our community. Miss Stacy Anderson, who's here, and Ryan are both on that committee. And so to provide the opportunity, again, for them to give us input and feedback, and then we have a scheduled meeting with the representatives from our teacher organizations to provide that input and feedback. Then on Thursday, we're scheduled to meet with our campus principals, and we have not left them out of all of this planning. The school leadership representative, Ms. Sherry McCaig, she has been kind of the liaison for the committee to the principals. She's been having frequent meetings with those principals at all levels to kind of share the guidance that's been given by the state, and then also to give us input and feedback. So I share all of that before we start because I don't want anyone that's watching this meeting or hearing some of this work to think that it just started. It's really been a lot of time and energy that has been spent on this, a lot of thoughtful time and energy in trying to develop the best plan possible. And I think everyone in this room can honestly would have to say it's a no-win situation. No matter which way we go, you fix one issue and you create a new one. And we're just trying to navigate through this complex, very, very extreme complex situation the best that we can. And we just ask that you have the trust in the district and in the leadership of Dr. Henry, who I just honestly believe has demonstrated that beyond more than anyone in his true commitment to the staff and students and to the parents of this community. And he's going to lead us, and we're going to do the best we can through this. So with that, I'm going to start with just really kind of setting out what I believe the requirements are, what the Texas Education Agency has said for school districts. You have to keep in mind, and I really want to also extend the same grace to the Texas Education Agency. Cy-Fair is not the only school district in the state. You know, we're one of over thousands of school districts. The level of community spread in school districts, it does not all look the same. So for them to have the challenge of creating guidelines and guidance that can best fit every district is a huge challenge. So the best that we can hope for is that we have some local control. We can look at our current situation and make the best decision possible. But what the state has said is that districts are required to provide on-campus instruction for all grades every day for every student. Okay, and that was really the initial guidance that was released. We had to figure out a way to offer that. Since that time, they've kind of modified and they have added some exceptions to that. One of the exceptions is that on-campus instruction is prohibited by an order issued by an authorized entity. State or county would be an example. That has created confusion. I know that a lot of the news reports are talking about school districts in Dallas County, El Paso, Travis, Bear, where they're saying they're going fully virtual. Well, there's a number of reasons why you may be hearing that. They could have a county order in place that's restricting them from providing in-person instruction. Yesterday, Judge Lena Hidalgo issued a letter, not an order. That's an important distinction. She issued a letter urging school districts in Harris County to open with no in-person instruction, no on-campus instruction. And I'm going to explain to you why that's not really possible for us. Campus is closed. Another way that you can begin fully virtual, a campus is closed as a result of confirmed COVID-19 cases, and the district makes a decision to close a campus. There are restrictions to that. The guidance says that we cannot close a campus for more than 5 consecutive days. So it's not like you can just shut down and say, we're going to sit and wait 2 or 3 weeks. There are restrictions that apply to being able to do that. A third exception is district chooses to adopt a start of the school year transition period. I'm going to explain more of that in just a moment. Districts choose to adopt a high school hybrid plan, and that was a new option that was just released on Friday. So again, a lot of this is new information. So here are the reopening options. You saw that we have to provide in-person instruction to all students except in those 4 situations. So we have the option, we could open 100% on-campus instruction. Do not offer the virtual remote instruction option to our parents and students. Or we could open with that choice. The third is the start of school year transition period. You've heard that a lot of school districts, even in our surrounding area, have chosen that option. When that option was first announced, it was a 4-week window. And the intent behind that was to address the school districts that I mentioned that are in areas that have a very early start date. Socorro ISD, Alief ISD, starting August 6th. It was intended to provide them the opportunity to finalize their plans and possibly begin a transition of bringing students on campus so that they would have sufficient time to be ready for that. So once school districts started trying to figure this out, they requested more time. They asked that it be extended. We need more time. 4 weeks is just not enough. Then we also started seeing the rise of community spread in certain areas. So Friday, the commissioner came back and they extended that 4-week period to now an 8-week period. But that 8-week period, that additional 4 weeks would require board approval. Now, there's an important piece of this that's never shared, and that I don't know that all parents understand and teachers understand. With the start of the school year transition period, you still must provide on-campus instruction for those students who do not have internet or technology devices or internet access. In our district right now, that's a large number of students. And it's not just do I have a mobile phone, it's do I have a true device to engage in true classwork instruction, live instruction. So again, another reason why we're recommending that we even try to extend our school start date to have more time for that. The high school hybrid schedule, this was rolled out on Friday. Again, if you remember, the initial guidance was you have to provide on-campus instruction at every grade level every day for the students and parents who wish to have that. Well, on Friday, the commissioner released what they're calling the high school hybrid schedule, but we can only offer that at the high school level, grades 9 through 10. That would be a model where you have half your students come on A day, half your students come on B day. You would alternate that schedule, and I'm not sure what you do on the Friday. I guess you just keep going with the A, B, A, B.
Teresa, just a clarification, it's 9 through 12.
Oh, what did I say?
You just said 9 and 10, so I just clarified.
I apologize. Thank you, Dr. Henry. 9 through 12. That is for grades 9 through 12. Grades pre-K through 8, you must provide on-campus instruction every day of the week, 5 days a week, for those students and parents who wish to receive that. So we would have high schools on a different schedule than our pre-K through 8 in that model. So in looking at all of those, it's our recommendation that we begin the 2021 school year with the two options, that we provide our parents the option of selecting on-campus instruction or what we have now labeled CFISD Connect. Learning at home is gone. Just don't even think about that. That program is gone. We now have CFISD Connect, and that will be the remote option. On the screen, you'll see a brief description of each model, and I really want to stress this because as parents begin to make that process of selecting which option, which learning option, they need to understand the difference in the improvements in the remote platform. There's great accountability with that. Students will be engaging in daily instruction during school hours, not at 10 o'clock at night, not on Saturday or Sunday, but students remain at home engaged in schoolwork during school hours. It's going to be two-way, real-time, live, virtual instruction and teacher-directed lessons and activities, and it will be according to the student's schedule. I'm going to follow first period, second period, third period. They're going to follow their schedule and according to the instructional calendar. There will be identified electives depending on the elective course that may require a student to report on campus in order to complete certain activities. Some of the best examples that I can give you would be welding, cosmetology. It's very difficult to show mastery of that content, to receive course credit in some of those career and technical education courses without having to come up and demonstrate that. But that will be, on a case-by-case basis as far as what the activity and what it is that the teacher needs the student to demonstrate mastery for. And I would like to stress that is for electives only. You cannot have the requirement for in-person instruction for any of the core classes. On-campus instruction will remain the same as far as students following their schedule on their campus according to the instructional calendar each day. Okay. So what are some of the things that you can see that would be the same for both, whether I report on campus or I choose the CFISD Connect? Both programs will be utilizing CFISD curriculum that addresses the Texas Essential Knowledge and Skills. Both of them, there's no difference. That is one of the requirements that the state rolled out, is that the remote option, the remote learning, needs to model what in-person instruction would look like. Even grading, accountability, all of that, there needs to be the same. Required services for our students that require special ed, 504, ESL bilingual, GT, dyslexia. Those are just a few of the examples. All of those services can be provided on both. The minimum attendance requirements. This is an important distinction and improvement in how we're going to be required to take attendance. There are attendance requirements that we must, there's no modification, no waiving of that. Teachers will be taking attendance for each class, each day. There are certain standards. I'm not going to get into that detail when we roll out more of the official plan. I think Dr. Macias will be doing that hopefully in August, more of the details for the board to approve. But there are attendance requirements in ways that teachers will take attendance on the remote platform for each class period each day. Students will be allowed to engage in extracurricular activities regardless of the platform, whether they choose remote or on campus. We just feel that this is important. This is just, we're not trying to create any kind of division on issues, and we want, this is hopefully a one-year situation, and we feel it's important to keep our kids engaged and participating in all of our activities. The CFISD grading guidelines and procedures are remaining the same. Again, I shared with you that's one of the requirements that the state has put in place as we create our plans. And semester exam eligibility will remain the same. When we learned of the ability to, or the requirement, I should say, not the ability, the requirement of daily attendance in each class period and the accountability that we have to put in place, we felt it was important to have to keep our attendance incentives in place so that we keep students that have selected a remote learning option to keep them engaged and not waiting until Sunday to do all their work. If they do not log in and do whatever it is that the teacher has scheduled for Monday, Tuesday, Wednesday, Thursday, and Friday, and they decide they're not going to check in or do anything till Sunday, they've been marked absent all 5 days. And when they're marked absent, that also goes to the meeting the 90% attendance requirement for course credit or promotion to the next grade level. So it really is a significant difference. I think this is going to be a great relief to our teachers that we're trying to manage the remote learning system in the spring. And I know I've heard stories of teachers just, you know, trying to make contact with students at all hours of the night and weekend and everything. So I do think that that will be a significant improvement. So moving on, now that you know what the two learning options that we're proposing, again, proposed, I keep saying that, this is not final. So as we started looking at the health and safety protocols, we felt it was important to try to divide them into prevention, what we try to do prevent any type of exposure or spread of the virus into our facilities. Then once we do have employees and students in our buildings, how do we want to mitigate that? How do we want to manage that to minimize the spread? And then in the unfortunate situation that we have a case, then how are we going to respond and react to that? Just think kind of how we rolled out our safety and security plan. We tried to look at that as far as prevention, preventing a risk or threat from entering. How are we going to identify it if it's there? And then how are we going to respond in the event of a security breach? Okay, so in the prevention, we are going to require daily health screening of all staff and students. This is going to look a little different. We are going to put the responsibility for daily health screening on parents. Parents do have the responsibility for screening their students and will educate them on the symptoms and what they need to do. We think that there is not going to be incentive to send your child to school sick because of the flexibility we're going to have on the remote learning plan. If a student chooses on-campus instruction and they are not feeling well, they think they may have a symptom, a COVID-19 symptom, instead of coming to school, stay home. With the technology device and the ability to just take attendance that day for that student on a remote platform, it removes any reason for that child to come to school if they feel that they may be ill. So we really do think that that's something that will be a true prevention measure. Staff members will be acknowledging that they do not exhibit any of those symptoms when they enter our facilities. The signs are posted with the symptoms and confirmation that you have not had direct contact with anyone that has COVID-19. Once they badge into the building, we have our keyless entry badges. That is their confirmation that they satisfactorily responded to that questionnaire. Restriction of staff and students from entering a campus or facility who show symptoms. Obviously, if you cannot satisfactorily respond to that questionnaire, then you're restricted from entry. And then we have clear return to duty and school protocols, and I'll get to those a little later in the presentation. So mitigation, face mask. I know there's a lot of questions about face mask. We will require all staff and students, even pre-K through 12. I know that the governor's current order says 10 and older. And visiting with our campus principals and other folks on our reopening committee, we felt like we needed to extend that to pre-K through 12 to the extent it's developmentally appropriate in classrooms, but they will be asked to put on a mask on buses, in hallways, and in common areas, and when social distancing is not feasible. So, and again, in classroom to the extent feasible for those pre-K through 2 students. But 3 through 12 will be asked to wear the mask. We will, just so you know, we will provide a mask if a student does not have one. We do think that some students will want to provide their own mask, so that we're not going to make that an issue. We will have disposable masks to provide them in the event they do not have one. Health and hygiene, soap dispensers, obviously in all of our restrooms, hand sanitizers in all the classrooms, buildings, and entrances to the cafeteria and building. Students will be asked to sanitize their hands as they enter classrooms. Educational materials for all staff and students on good hygiene practices. Our communication team has done an amazing job of developing these short little video vignettes that will address areas such as washing their hands, wearing their masks, social distancing, etiquette, proper etiquette for coughing and sneezing, and all of those materials will be age appropriate, level appropriate, and will be provided to the campuses for use with students and staff. Sanitization of student desk after each class period or transition period. We will provide a spray bottle of sanitizer, towels, and those things for every classroom in the building. The way that will be implemented obviously will look different according to the level of the student. It could be, keep in mind in elementary, there are less transitions. Kindergarten, they're all in the same classroom, but as you get to the older grade levels, they have their switch class, so there's less transition. And we're going to really let the campus principals at the elementary level and really at the secondary level work with their staff to determine what they feel is the best protocol and procedure. Teachers can walk by, squirt desks. Kids can then be provided the paper towel to wipe off their spaces before going to the next classes. Frequent sanitization of high-touch surfaces. This is, doorknobs, any kind of surface in the classroom, we're really going to limit the shared supplies, but if there is anything that needs to be shared, you saw us sanitizing the podiums and those kind of things. A lot of behavior modifications, a lot of changes that people just are going to have to stop and think about to try to really practice those good health and hygiene practices in all of our areas. In our office spaces, that could be sanitizing or having hand sanitizer at entry to elevators, well, really even in our campuses. Entries to elevators, by copy machines, those areas where you may have a lot of different people coming through and touching those surfaces. Student-teacher groupings. This is something that the details of this are going to be difficult to lay out right at this time. Once we are able to get the data back on the number of parents that have selected on-campus instruction, then that is when campus principals and campus staff can really begin the real work of determining how they're going to manage that best. And when you really are able then to look at the number of students that are going to be reporting in each class, what changes, what modifications, if any, we need to make, and social distancing in those areas and in those classrooms to the extent feasible. One of the agenda items that you saw on the agenda for today's meeting, we're asking the board to approve the district moving forward with being able to purchase plexiglass teacher desk shields. We're going to have one of those for every single teacher to where it's a shield that sits on top of the desk and it provides that plexiglass barrier for them, and then also for student desk and tables in identified area. Again, I think that's going to be based on how much social distancing you're able to create in an individual classroom. We know that many classrooms, as Ms. Campbell indicated, I think when she spoke that she has tables in her classroom, tables would have a first priority, because if you have tables, unless you're able to really create social distancing with students, that may be where the first priority is, that I need to have those tabletop desk shields around a student to create that barrier for the students and also for the teacher. I do want to say here too, we recognize, and I think I'm a secondary teacher, and so I think just thinking how I would manage that, it's a little bit easier versus some of our elementary classrooms and our little ones. And so we know that it's going to take some work with the campus administration and teachers of kind of looking at modifying really what are best practices for groupings and working with those students, and how can we create that physical distancing while still providing quality instruction in those classrooms. But there's a lot of different strategies that we can employ. It's just not, it may not look the same, and that's understandable. Teachers are not going to, in all situations, be able to interact and work with students in exactly the same ways that they have in the past. So those modifications will just naturally have to happen. And again, our principals are ready to work and support our teachers with developing those in the classroom. Transportation, we talked a lot about transportation, and we know that first off, our transportation drivers have one of the most difficult jobs to begin with. And so really trying to determine how we can best put health and safety protocols in place on our buses. One of the first things that we're going to do is we're going to ask parents to register for transportation service. This is a practice that many school districts already utilize, and it assists the transportation departments in planning their routes so they know, instead of routing for every student to ride a bus when, for instance, my children never rode a bus, they are able then to determine who is actually riding the bus, and then they can plan their routes to try to reduce the number of students on that route instead of waiting 2 to 3 weeks to level them. We're working to also reduce the number of students on that. I don't want to say an exact number until, again, we see how many students are going to be accessing our bus service, and that registration, which will be one of the questions when we distribute the questionnaire to the parents on Monday. That will be one of the questions that they respond to. Face masks will be required on the bus. If a student enters the bus and does not have one, we'll have disposable face masks for the driver to provide the student. We'll have a hand sanitizer and ask the student to sanitize their hands before taking a seat on the bus. Drivers, and again, I'm going to say as frequently as possible and to the extent feasible, because again, knowing the challenge of their jobs and sometimes how close their routes get depending on traffic, we are going to make every effort to disinfect those buses between each route. And then the buses would be fogged with disinfection solution at the end of each day. The cafeterias, that's another area that we're working to try to minimize the number of students congregating in that space. You know, even back on student and teacher groupings, I didn't talk about this, but even in the hallways, many of our campuses at the secondary level where, you know, you can have large number of students at the hallway at any one time, they're working to create one-way hallways One of our principals called it the lazy river because of the floor plan of her building. She said it could just be you get on the lazy river and you go around and you create a one-way hallway. Many of you may have seen that practice utilized in many retail stores. They have one-way aisles. Not many people comply with that, but we're committed to having our students, with the support of our staff, follow that. So that helps minimize that congregation and that congestion that just naturally occurs when you have groups coming both ways. Some floor plans don't allow for that because of just the floor plan of the building. I can speak to Cypher High School, one-story building. So there's different strategies, again, that each campus is going to look at and implement that best fits their situation. So those are other strategies for reducing that congregation. At the cafeteria at lunchtime, again, usually typically a time when we see large number of students in a space and area. At the secondary level, all of our principals are looking at a way to increase the number of lunches that they have on their campus so that they can reduce the number of students in the cafeteria. Our nutrition services team is working with each school. And again, I can't give all the details because each school looks differently as far as how their cafeteria is laid out. And some of our newer schools have different kind of cafeteria line setups where kids select their food. But we are committed that there will be no self-service or pin pads to reduce those high-touch surfaces for students. Grab-and-go breakfast, kids would just be picking that up and grabbing and going. Limited menu items and no a la carte options, again, to reduce that congregation and congestion that could occur. Social distancing to the extent feasible in the cafeteria, again, until we get good numbers at the beginning of August of the number of students that are selecting in-person instruction. We can get a better idea of how the social distancing, but campus principals are looking at a variety of ways to create as much physical distancing in that space as possible, utilizing their multi-purpose gyms, their courtyards. Sarah Hardy at Cy Lakes has great strategies and ideas when she had over 4,000 students in her campus and trying to feed them. She had to create get very creative and utilizing a lot of different spaces to help spread out her students during lunchtime. And then frequent sanitization of serving lines. One of the other things, and Mr. Morgan may have more information that he can provide, one other item that we're looking at, but we're uncertain if this is really feasible, are the same type of little shields that could be put up in the cafeteria between students at the cafeteria tables. But with that, sometimes you're creating another challenge of being able to clean those in between each lunch, and is that really feasible to do that? So we're exploring that and really trying to determine if that's a possibility. Visitors at this time, no visitors except those required to conduct essential business. And I know that this is so hard because we're such a people business. We love our parents, we love our volunteers, and we love for parents to come have lunch with their kids. We have our faith-based leaders that come and make connections with our secondary students during lunchtime. But obviously, given the current circumstances, we feel that it's necessary to put those restrictions in place. But visitors that are there to conduct essential business will be required to go through the health screening, the same screening that our staff and students go through. We're exploring the capability of our Raptor system. Those of you that have visited campus know that they scan your driver's license, you can get a visitor badge. We're trying to explore having that then just a touchless surface where that is scanned, and then the visitor has to satisfactorily respond to those screening questions. And if it could even print on the badge that, yes, I have been screened, and then say you have a visitor that says, well, someone in my family has COVID. Well, that visitor would not be allowed to enter the campus. And if that is so, we're looking at the capability of the system capturing that, because that individual would be restricted from entering a facility, that campus or any facility in the district, for 14 days. So we need an ability to log that in our system to be able to track that. And as I mentioned, no lunch visitors. Our clinic, our nurses, we know that, and these are just some key things. There are many more protocols and procedures that Ms. Bernal is working with our nurses on, but again, depending on what their spaces look like and the level, elementary versus middle and high, there's different strategies that could be implemented and utilized there. But key things that we know that we have to provide regardless of the campus is identified isolation spaces for students that may be symptomatic or ill, increased ventilation through air purification systems in the nurse's office, the addition of physical barriers such as partitions, screens, curtains, all of those things to create as much protection as we can, and separation for sick and well visits. I know in some of the protocols and procedures that Ms. Bernal has developed and is working with her campus nurses on is their ability that we can go to the classroom to see a student versus having them come to the clinic. But again, that would depend on the level, the staff that's available, and so there are many more protocols and procedures, but those are key to all of the clinics at every level. So in the event that we have a staff or a student that is confirmed COVID, suspected, or presumed positive, go ahead and go to the next flow chart. Okay, you can't read this, and I'm not going to try to read this chart to you. This will be shared with all of our parents. This is one of the flow charts that's currently posted on the intranet for all of our employees, so you have access to that. But the same flow chart and process and procedure will be in place for staff and students as far as what would be the restriction for a student or staff if they have tested positive for COVID is the orange box. The purple, the student has COVID-19 symptoms but no confirmed case. The blue is student lives with someone that has COVID. And then the last one, the student has prolonged exposure to someone that has tested positive. So then you can see there's a flow chart, notification, excuse me, I just totally lost Ms. Bernal. I apologize. Health Services Department is notified immediately in all those cases, and really it's very individualized. I think she would be the first to tell you everybody wants the same concrete answer and response and process, but it's very individualized and dependent on the questions and how that individual responds to those questions and how she guides and directs them through that process. You can go to the next one, Abby. That one is the same for staff. So there are very defined protocols and procedures in place for that. The social and emotional well-being, Dr. Schluter and Franklin Sampson are on our reopening committee and are committed to making certain that we have measures in place to support the social and emotional well-being of not only our students but of our staff. And just some key things, again, there are numerous other measures and things that are going to be happening and support that it's available, but staff will be trained on school reentry and social and emotional well-being and trauma-informed care, social and emotional wellness resources shared with our community. We have highly trained counselors on all of our campuses, and then our staff, this is something that's always available, 2 free counseling sessions available to staff through the CFISD Wellness Counseling Program. Okay, I know we've had a lot of, specifically teachers, and I think this is completely understandable, have a lot of questions about how leave will work through this, and so I'm going to turn it over to Sharita Franklin, our Assistant Superintendent for Human Resources.
So another resource that we have for employees is related to the Family First Coronavirus Act. And so the FFCRA establishes paid sick leave and paid extended family leave for specified reasons related to COVID-19. The provisions under the FFCRA began April 1st, and they are slated to end December 31st of this year. So under the FFCRA, an employee is entitled to take leave related to COVID-19 if the employee is unable to work for the following qualifying reasons. The employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. The employee is advised by a healthcare provider to self-quarantine or isolate related to COVID-19. The employee is experiencing COVID-19 symptoms and is seeking a medical diagnosis. The employee is caring for an individual that is subject to an order described in the first two reasons I just spoke about. Or the employee is caring for his or her child whose school or place of childcare is closed due to COVID-19. The amount of paid leave an employee may receive will vary depending upon the reasons the leave is taken. Detailed information about the pay provision is available in the Employee Rights Notice found on the district's website. The following paid leave may be available to employees when emergency paid sick leave is exhausted. And you'll see there that local leave may be available, state personal leave, or vacation days according to the employee's leave bank. The district is authorizing an additional leave category under our current DBB local policy. The leave category is titled administrative leave. Administrative leave may be available when an employee is required to self-quarantine or isolate due to contact tracing for CFISD workplace exposure. So basically what that means, if someone has been exposed at work and they've been advised by a healthcare provider to self-quarantine, administrative leave may be available. Under the administrative leave provision, the employee may be entitled up to 10 workdays of paid administrative leave per each isolation incident. While on administrative leave, employees will be assigned to duty at home and must be available for duty during their established work hours. I will now turn the presentation over to Paula Ross, Assistant Superintendent for Technology.
Thank you, Sharita. At the special called board meeting just earlier this month, Technology Services introduced the CFISD LTE One-to-One Learning Together Everywhere initiative. This initiative will provide a Chromebook device for every student, plus provide internet access for students that demonstrate a need. Since that time, the Technology Services team has released requests for quotes for service providers on the Texas Department of Information Resources contract. Upon receipt of the service provider's responses just last week, Technology Services began the evaluation process. The team spent several days evaluating the responses, and the following recommendations were made earlier this week. To provide internet services for students that demonstrate a need, we have selected the following providers. Verizon was awarded 15,000 MiFi or hotspot devices with guaranteed delivery to Cypress-Fairbanks between 3 to 4 weeks, so before the start of school. T-Mobile was awarded 5,000 MiFi devices or hotspots along with guaranteed delivery to Cypress-Fairbanks. Each vendor provided their coverage map that showed complete coverage of our district. However, the team spent time testing the upload and download speed by connecting to a Chromebook device and testing Schoology, our new learning management system. As you might predict, some devices perform better in certain areas than others. Therefore, based upon our testing results, we determined that the best option would be for a dual award. We believe this will offer optimal coverage for our students. As far as the device selection, the team determined that Lenovo Chromebook continues to be the best choice for the district. Again, these devices were tested by several team members in several different scenarios. As recent as yesterday, Lenovo was sent CFISD's letter of intent, and Lenovo has guaranteed the allocation of devices for Cypress-Fairbanks. 10,000 devices will be delivered in August, 15,000 devices to be delivered in September, and the remaining 55,000 devices to be delivered during the fall semester. In conclusion, Technology Services is currently working with our communications department, school administration, and curriculum and instruction to create a questionnaire for our families. The responses to the questionnaire will help determine the strategy to be used for distribution of both Chromebook devices and MiFi hotspots. At this time, I would like to turn it back over to Teresa Holt.
Thank you, Ms. Ross. I think I've already covered the timeline, but on this slide, you'll see again some of the information I shared at the beginning of the presentation about the meetings that we will be conducting the remainder of this week. On July 27th, it is our intent to distribute our reopening CFISD plan and our return to school questionnaire to all of our parents. And then, in that reopening CFISD plan, I think currently, Ms. Francis, it's about, 15, 16 pages. So there's a great level of detail in there about all the different options and information on all the areas that we talked about today. And then there will be a link to the Return to School questionnaire. Parents will go into the Home Access Center, which is their access to their individual student information and gradebook, and the questionnaire will be there. It will be recorded there, and that will allow campus principals to see in real time, live each day, how the information, what parents are selecting. Parents will be able to complete that questionnaire until August 5th. On August 5th, then that's when we're going to look at the data and see what the numbers are for the selection of in-person versus remote instruction by campus. We have a board meeting, a committee of the whole meeting scheduled for Thursday, August the 6th. We'll provide you with an update at that meeting on what the data is indicating and work to finalize our plan for the reopening. Then on August 25th, that would be the deadline for parents to make any changes to their 2021 learning option. And the significance of that date is the state said that we must provide parents up until 2 weeks prior to the first date of instruction the opportunity to change their election. And I think that's a fair thing to allow parents to do because, as we know, this whole situation could change in 2 weeks easily. And then September 8th would be the first day of instruction if both of those two items, August 25th and September 8th, are pending your approval of modifying the school start date. So that's the end of our presentation, and we'll now turn it over to Mr. Covey for questions.
Ms. Hall, that was an awesome presentation. Thank you very much. I'm going to start at this end over here. Gilbert, you have questions, or am I coming to you too quick?
Yes, outstanding job, Teresa, and the whole staff. You seem to answer many questions that we've been getting on the side about just very ones you're answering and stuff. I do like the lazy river, as you call it, because that was a major concern, especially on, with social media and the kids all getting on one side and everything. I think the lunch issue is going to be an issue going through, but hopefully we can get through it. Has any thought gone into maybe staggering the release times on classes?
Yes, and I failed to mention that. Depending on the level, high school, it's a little more challenging to do a staggered bell schedule because students don't necessarily follow together. At a middle school, you can do that. 6th grade classes go to 6th grade teachers. 7th graders go to 7th grade teachers. But in high school, trying to figure out how to stagger that, because I could release one section of the building, but they're trying to go to a classroom where there's still students in there. So depending on the level, it determines the ability to do that.
Right.
But they are looking at other strategies to minimize that congestion in the hallway.
Well, thank you. And also, I'm encouraged by the letting the students participate in extracurricular activities, either if they're on virtual or face-to-face. So I think that's a huge plus for many of the students to stay involved in the everyday aspects of going on. I do plead patience to the community because, like it was spoken before. This could change next week or in 2 weeks. What we went over and just approved can just be all another emergency board meeting, because it's going to be a changing, especially during the fall, I believe. And I want to applaud you and your staff for doing much problem solving, because it's going to go on the whole year. And I say prayers for you and the whole group and stuff. And we're certainly behind you 100% on the efforts that you're putting forth. And just ask patience for the community to continue trusting in the people here that make these decisions and stuff. We're doing it for the welfare of everybody here, and certainly not trying to harm anybody in any way at all. That's it.
Thanks, Mrs. Arabia. Mr. Jackson.
As usual, an excellent presentation, very thorough. This is not the first time that you've given us this presentation. Starting all the way back in March, we've had hints of this. So it's not as if this is brand new. I know in March, when Dr. Henry reached out to each individual board member, and indicated a private phone conversation, and I think we all took advantage of it. And then ongoing, I used 3 words: patience, flexibility, and slowly. By slowly, I encourage senior management to not to proceed with haste, but calmly and slowly. As I've said numerous times, whatever we decide on a Monday is likely to be wrong by that Friday. And that will continue at least for the first 4 months of school, and maybe for the entire school year. And so on my morning hour-long walks, I always hear a lot of frustration from parents. That's understandable. But once again, the answer is patience, flexibility, and let's proceed slowly and cautiously. In May, my board colleague, Julie Heinerman, reminded us that that was Mental Health Awareness Month. And Cy-Fair, long before COVID, we established something that other districts are now looking to emulate, but was pointed out as best practice, and we have a mental health team. Teresa, would you comment very briefly for the viewing audience what this is?
Our mental health team?
Yes.
Yes. We have 2 teams that consist of 2 counselors, highly trained counselors, a psychologist, and then a mental health officer. They really kind of, I guess they divide kind of sections of the district, and they provide support to students that are in crisis or in need of additional resources and help. And then they also are the liaison with the parents and with any outside resources that a child may need to have access to. In addition, I mean, they support our staff as well. I mean, they're hired to do students first, but they provide tremendous support and help for our staff. So I hope I answered your question.
You did, thank you. Proceeding along that line, another attribute of this district is placing trained talent at a specific need point. Do we have nurses at every one of our schools?
Yes, we hire registered nurses, and Ms. Bernal may want to chime in there. We have RNs at every single one of our campuses, all 92 campuses.
Thank you. We chatted about employee leave, and of course, every trustee up here has received questions on this from staff. For the federal paid leave, where does the money come from, and who gets the money? By that, do I mean, does the money come to the school and the school disperses it, or does the employee have to go to the federal government and request the funds?
So while this provision was put in place from the Department of Labor, with us being a federal or a public employer, not a federal, but a public employer, we are not receiving reimbursement for the leave that is required. So the leave is coming from the district. And the employees will request leave under the Emergency Paid Sick Leave Act or the Extended Family and Medical Leave Act through the district, as they do when they request personal leave or sick days.
So we are, at this point in time, there is no reimbursement either from the federal or the state. Is that correct?
That is correct for public employers. That is not correct for a private employer, but yes, that is correct.
Thank you. A question for Karen. We have a budget, and I think the line item was approximately $10 million to deal with COVID-related items. Is that correct?
Yes, that's correct.
And we use part of that for our extended technology, and I suspect you will be asking us to use some more of that for the enhanced sanitation and mitigation. Is it your anticipation that this additional leave would come out of that line item, or is there another line item of cushions that we have to look for?
Well, originally, I would say we were looking at all the possibilities of what might occur. It's just like others have shared, it was very fluid. So we were looking at, are we going to have substitute cost? Are we going to have this leave? What sanitation, all the possibilities, and just came up with what we thought at the time was the appropriate amount to budget. As you well know, things have changed. And so I would say that we budgeted $10 million. We anticipate spending approximately $3 to $4 million related to the actual service for the LTE devices to provide internet service. And then we will be coming to you with another little over $3 million, close to $4 million related to the plexiglass. So as you can see, that's already $8 million of the $10 million.
Now you do have a cushion, and you haven't asked us for it yet, but I think you indicated you may be asking us in September when we establish tax rates. Or perhaps in August. So it is not that we are without, but you haven't formally come to ask us for that yet. Do we have any other ideas of significant potential expenditures out there?
The main thing that we've thought of right now is also substitutes, as I indicated, and then we've already talked about the LTE and then the leave, but then also the cleaning of our facilities.
Very good. Thank you. I appreciate it.
Mr. Jackson, if I could just add one little caveat to that. Many of you in here may have influence with your local congressman, but there is a push at the federal level to help meet the needs of all the funding problems this COVID-19 is causing with local school districts and cities and counties. So if you have access to your congressperson, I would encourage you to make sure that they give us the same benefit that they've given the business community.
Thank you for that observation. Many of these costs we don't receive reimbursements for, and COVID will strain the resources of the local community and our local taxpayers. And the money does have to come from somewhere. We've already covered the update of technology rollout. Mark, if you would, comment briefly about UIL activities. You touched on it at the beginning. I believe you still sit on the UIL committee.
Yes, sir.
And so give us a sketch of what the current thinking is, and granted, it could easily change again, right? But what does it mean for fall sports, band, all that sort of thing?
Well, first of all, I've been sitting on the UIL Legislative Council for 20 years, the longest of anyone else. And having been on there that long, I know how important activities are to the leaders of the UIL and that state organization, and they're determined to make sure that we don't have a repeat of last spring, which was not their fault. So whatever we have to do this year to make sure our students are playing football, volleyball, baseball, marching band, robotics, one-act play, all of those activities will occur this year. The schedule we already know the schedule is going to look a little differently because 5 and 6A schools, it was released today, will be able to start practice. I believe it's right after Labor Day, and then the first game will not be till late September, and I think it's like the 27th, but I can't remember the exact date. But a full schedule of volleyball, I think, beginning on the 16th or 17th of September, and football about 10 days later will take place, and championships will be moved to January. So, all of our young people, especially high schoolers out there that are worried about that, I think the UIL is determined, and if the UIL is not determined, I'm determined to make sure that all of our students have those activities fulfilled this year at some time or another.
And thank you for stressing that, not only for our district, but also at the state level. You touched on it very gently at the beginning, but I do think in times of high stress, and this is one of them, just like Harvey was, but this is much longer than Harvey, these co- and extracurricular activities for our children provide a brief window of normalcy, and normalcy is of critical importance for our kids as they go through this. Equally important for parents, but parents will be a lot happier when the kids are happier. Do we have, and this is a question I always ask, do we have a way of identifying how big is big and how small is small? By that, do we have a feel as to what the potential positive test rate is for our community of approximately 140,000 adults and students? What are we looking at in the coming year?
I'm sorry, Mr. Jackson, I can't answer that. I don't know if Ms. Bernal can, or that's certainly putting her on the spot.
Well, I've been known for asking unfair questions.
Step up here.
She said she would find out the data and say, and I apologize. I have not been referring to you as Dr. Bernal, so I apologize.
You know, I think it's useful for our viewing audience to be aware roughly the state of Texas has a 1% occurrence rate, tested occurrence rate over a 5-month period of time. But that's for the general population, which is completely different than what a school population is. But with 135,000 students and employees, 1% is about 1,000, a little bit more, 1,400, over a 4 to 6 month period of time. You've identified we have a flow chart for when a student returns to campus. And by the way, that's excellent. Y'all always do excellent work. Tonight, I think y'all went above and beyond, and I appreciate it. So if we have an occurrence at a school, is the current thinking that we shut down that classroom, shut down the school, or does that student then go home and returns according to the flow chart while they're doing schoolwork at home online? And I know, and I'm not looking for a hard and fast answer. Just where are we on conversation on that? What's kind of the thinking, the thoughts?
That's a great question, and I think every situation is going to be very individualized. And again, it's kind of like when individuals call Dr. Banal and want this one set answer of how you're going to handle that. I think we're going to have to look at all the factors, the number of students or staff that individual may have had direct contact, how many are impacted, what is our ability to continue and maintain the continuity of instruction in person. So it could be an individual classroom, it could be a campus. I think it would have to look at all factors. We kind of compared it to the factors we have to consider when Dr. Henry has to make a decision to close a campus or close a school due to inclement weather or any other natural disaster. You just have to gather all the information that you have and make a decision based on that. So,
Well, and that's a good answer. I think we needed to ask the question. I'm old enough that the old-timey answer is we'll cross that bridge when we get to it. And I know our parents won't like that answer, but until we're there, we won't know. We won't know how big is big and how small is small. Once again, excellent presentation, very thorough. I appreciate it. I know it is very stressful for those of y'all, but thanks for taking this on.
Ms. Blacksher.
Thank you, Mr. Covey. And Teresa, to you and your committee and to all of administration, what a great job. This has not been an easy task for anyone. And when you take into consideration that this district has over 118,000 students, and we are dealing with their lives and how this all affects them. I know you all have put in tremendous hours and have probably had many sleepless nights, as some of us have as well, because I know from the onset I have worried about the mental health of some of our students, as well as those that might have factors at home which makes it unsafe for them, yet they have been there since the middle of March. And then I think too about our students that need that face-to-face classroom instruction, our life skills students. I in particular have a grandson who deals with dyslexia, and his mom and dad were both essential workers, so he and his sister were at our house in the spring, and I was trying to help as best as I could. And I watched him, and he had many Zoom one-on-ones with his teachers. But I know as a grandmother how important it is for him to be back in the classroom, because he learns better when he is face-to-face with a teacher. And just concerned for our students who may not be fed. I mean, we're doing our best, and food production and Darren Crawford his group have done an amazing job in feeding our families in the area, and that I'm very appreciative of that. But I just hope that our parents are aware that we all do care very much about your student, and we do want what is best for them. And none of our decisions are easy, but, you know, as a word that I've learned over the last 10 years has been fluid. And this has definitely been what you could consider a very fluid situation, because as my colleagues have pointed out, it changes from day to day and sometimes from hour to hour. So thank you very much, Teresa and Dr. Henry, and all of the associate and assistant superintendents and people that are supporting them, because I am thankful that the students in Cy-Fair ISD have this administrative team trying to figure out the best avenue for you in this school year, and appreciative for the fact that our parents have choices, whether to send their student to school in person or to keep them at home, because this is such a uncharted territory, and I really believe it is important that we let the parents make the choices. With that said, I do have some questions. One thing I would like to know is what has your discussion been on social distancing on the buses? What is that going to look like?
I'm going to let Mr. Powell come up
Okay.
because he's been working with.
Well, a lot of these questions are questions that parents have asked me.
They're
so-
great ones. They're great questions.
Those are great questions. If you look at a school bus, it's very difficult, it's very challenging to social distance. And some of the guidelines that first came out, we're talking about one child per seat, every other seat, which you're taking a 71-passenger school bus and making it an 8-passenger or a 12-passenger school bus. So we realized from the get-go that's not feasible because we transport 85,000 students in our district. So what we focus on is the sanitization of the bus and minimizing the amount of students that are on the bus and the time that they're on the bus. So that's our goal going forward. Hopefully we'll have all the people that want to ride the bus register. And I know that's a challenge too, but once we get the numbers registered, then we'll have the number of kids that we can actually put on the bus or that we'll have on the bus. So that's definitely going to help us in our planning.
Okay.
So right now I can't give you a firm number because we really don't know how many we're going to have returning.
And I would think too that even with the students returning to campus, that parents that are have the ability to take their kids to school and pick them up may choose to do so during this time, and that if we get to the spring and we have vaccines and situations are different and more kids are returning to school, then the bus routes and capability may change as well.
And that's definitely an option as well, yes.
Okay, thank you.
You're welcome.
It was a great presentation, but I still am quite not clear, and I know it'll vary. But for example, say a teacher in the classroom tests positive for COVID. So how exactly are we going to deal with that situation?
I'm going to ask Dr. Bernal to come up because I think she can speak in more detail about the questions and how she'll process
And I'll
them.
say a teacher or a student.
Absolutely.
Good afternoon, everyone. The question was in regards to a person.
If a person in the classroom, either the teacher or student, tests positive for COVID, how are we going to handle that?
Sure. This person would be isolated immediately in the designated isolation spot, and then depending on whether it was a teacher or a student, we would either call the parent to come pick them up, or the teacher would drive themselves home if they're unable. If it's a medical emergency, of course, we would call 911. We would work with operations, of course, to have the area deep cleaned, disinfected, and then we would, of course, work with our local health authority, with the Harris County Public Health Department, to assess what needs to happen next.
Okay.
Whether
would we be quarantining the whole class?
It depends on the prolonged contact that has occurred. Did the teacher wear a mask? Was there a social distancing occurring? How long were they together? You know, it's all these individual factors that play into this situation. So it's very difficult to give you a very clear cut answer. This is what we will do in this instance. It all depends on the individual situation, which we would assess and then make the appropriate recommendations based on our knowledge as well as that of the health department.
Okay, I have another question
Sure.
for you. One parent observed to me today that, you know, going into the fall, we begin the flu season. So sometimes I say sometimes, a lot of times it's taking a while to get results back. And how are we, you know, is it the flu? We always have cases of strep throat. Is it something else? How are we going to deal with that?
That indeed is a very tough question that we've been asking ourselves and discussing with the health department as well, because as we approach flu season, we're very concerned about both of these viruses hitting us. Our nurses, as you might know, registered nurses are not allowed to diagnose. They can assess based on their nursing judgment, but we cannot diagnose. So what we can do is refer to the healthcare provider. So based on the symptoms that a nurse will see in a child or in a student, they would then make the recommendations to seek further evaluation with a healthcare provider to see whether it is COVID or the flu. And they would stay home until, the symptoms allow them to come back or the healthcare provider feels that it's safe.
Right. And how are we going to require a note from the doctor when a student returns so that we know they've been seen by a physician and we know that they have been cleared to return to school?
There's two different strategies for the return to school based on symptoms, which is fever-free for 24 hours, 10 days since onset of symptoms, and improvement of symptoms, or it can be a test-based strategy, which then requires 2 negative tests within 24-hour period. Or we can use a healthcare provider note stating that whatever symptoms the person is experiencing are due to something else other than COVID, and then they could return.
Okay, good. Okay, thank you, Dr. Burnell.
You're welcome.
Let's see. Okay, did I understand correctly, Teresa, that if a student who is attending class in person tests positive for COVID, they can switch over to virtual?
Yes, we're fortunate that TEA has allowed that flexibility, that even a student that is in-person instruction, if they're absent even for one day unrelated to COVID-19, if they meet those standards for attendance for remote instruction for that day, we can count them as present.
Okay, and how would we, if they've been in a school classroom, how would they know where to go virtually?
That's another great question, and that is that's the reason for the one-to-one. Every student will be logged in and engaged in Schoology, really whether they're in person or virtual, so that we can have that seamless transition in the event that an individual student has to be absent for self-isolation or quarantine, a classroom, a whole campus, so that we can maintain that seamless continuity of instruction.
Okay, and I am going, and we will have teachers who will teach in the classroom and teachers who will teach virtually. Is that correct? We won't have a teacher who's teaching to a classroom also be teaching virtually at the same time? Are they going to be two different?
Do you want to respond to that, Dr. Macias? I'm going to let her, because she's been talking with the principals on the instructional piece.
Mrs. Blackshear, a lot of that will depend on the number of students that actually, or parents that decide to send their students to in-class instruction. We have developed instructional arrangements for all of the different levels, and we have visited with our campus principals. And so depending on the level, for example, pre-K through K, the teacher will either have to be a virtual teacher, a remote teacher in classroom in CFISD Connect, or will be an in-class support teacher, because that's pretty much the way the guidance is from the state.
Right.
For the other grade levels, the principal will make a decision whether a teacher is teaching an in-class group and maybe has a couple of kids that are joining in, connecting into the class. We already do that.
Right.
We already do that in some situations. It's not new to us. Or the principal may decide that there are possibly enough students where they can do just an in-class, or or just a CFISD remote. That will be that decision will be made by the principal based on the situation at the school.
Okay.
It all comes back, Ms. Blackshear, to the survey.
Right,
to
right,
see
right.
who we're
yeah.
serving.
And, you know, and just with the responses I've been receiving, I'm just guessing that we're probably going to see about 50-50. But let's see. That leads to my next question, Dr. Macias. So if a teacher has certain may have certain health conditions, or as Ms. Campbell said, her husband does, are we going to try to accommodate and put them in a, and I guess I see Sharita coming, put them in a virtual classroom versus an in-person classroom?
So we certainly are going to do our best to accommodate, but when we talk about the actual environment, we're still talking about a school building environment. And so when you're looking at a virtual classroom, you're looking at being in a school building in a
They would
virtual
be in the
classroom.
building anyway. Right, okay, okay. That answers my question, thank you. Well, let me, just a minute, Sharita, let me ask another one. I'm sorry. So, reading that Families First Erroneous Response Act, I want to make sure I understand it. So, say an employee, say they may have COVID, and so they will be covered under this. And then what if a month later, one of their dependent family members has it? They would be covered again?
So there are 10 days under the Emergency Paid Sick Leave Act that employee would use if they have COVID.
Is that aside from what they already have with the school district?
That is correct. That's what's been given to employees as of April 1st. 10 days of paid leave. So they can have 10 days of paid leave to take care of themselves if they have COVID. If they exhaust that 10 days of paid leave and then need to care for a family member because they then have COVID, they would use their personal leave banks in that order that you see on the slide.
Okay, okay.
Under that scenario. So if the employee still had leave in the emergency, if we switch the scenario and they didn't have COVID and they went to care, they were just caring for a family member, then they would have access to those 10 days of paid leave, but the value is different. It is at 2/3 pay.
Oh, okay, okay.
And then they can supplement that with their paid days.
Okay. And then I'm going to try to throw another kink in. So what happens if they become, and I guess we really don't know where a person gets COVID most of the time. But if they were in a classroom and, I thought you had all the answers, Don Ryan. Oh, Kroger. But what if a teacher is in the classroom and a student tests positive and then they become sick with COVID? Does still just that 10 days one time apply?
That is correct. It is a 10-day leave provision that ends December 31st. So the leave does not get replenished at any point.
Okay.
They would cascade to their personal leave after the 10 days have been used.
And it wouldn't be considered a workman's comp issue?
So if someone that hasn't been identified, so I'm going to defer
I know. I'm
to-
asking.
So
Yeah,
I can answer that, Ms. Blackshear, because I actually, when this first started, worked with our Director of Insurance and Risk Management, Jamie DeCantillion. And she and I, because when this first started, the workers' compensation insurance companies were watching it closely. Once we moved to community spread, I've been advised, and Jamie has continued to check with our providers, is that those claims are typically not being honored. They're being denied. Because when you are in a community spread situation, it's
almost impossible to trace it directly.
Right.
Now,
Okay.
what I will say to emphasize in regard to a teacher in the classroom, if there is a situation where the teacher is determined to be a close contact, as Dr. Bernal has identified, simply because you're in the same building or even in the same classroom with someone who's been identified, doesn't mean you're a close contact and that you'll have to self-isolate. But in the event, we have staff members, because they are reporting to duty, and they are required to self-isolate because they've been identified as a close contact of a presumptive positive or confirmed positive of COVID-19, then we do have local leave available, and it's administrative leave, and it's under the policy DBAA, Sharita? DBB. They start running together alphabet soup. But, and so through that, you may have up to the 10 days needed to isolate, and consistent with the CDC self-isolation regulation or recommendation for each instance. So that is something that does not have a finite value. What I would also say, Ms. Blackshear, is that as a board, you give campus-based employees 5 days of local leave, and that's what we call discretionary leave non-discretionary leave, and it's available for personal or family illness. And so the law does not require that. So you already give employees 5 days a year, and many employees don't use all 5, and so they accumulate. You've
Right,
also decided locally that you're going to allow employees to accumulate that leave.
Right, right.
And then something that you've also done as a board is that you give, the law dictates family medical leave, but you also as a board give extended temporary disability leave to all employees, not just teaching staff, and the law does not require that either. And so in addition to the 10 days for the federal, identified that the federal government is requiring us to provide, you give 5 days of local leave, that's for personal and family illness. And then there are additional 5 state days that are discretionary days, as they're typically referred to. And that's because those are 5 days that an employee with advanced approval can use. I've got to close on my house. I've, back when we had lives, I've got, something that I've got to take care of in regards to, personal business is how they're sometimes referred
Are they
to.
able to accumulate those days as well?
Yes, ma'am.
Good.
Great question. And those accumulate. And so some of our tenured employees have months and months of paid leave. And so, but say you're a brand new teacher, you have 10 days of emergency paid sick leave for personal illness. Then you have 5 days of local leave that this board has given, and so that's 15 days for personal illness. And then we also, Sharita and I have looked in administratively, we believe Dr. Henry can remove the provision for state leave that it be pre-approved, which we will do. And so then you have 5 more days of personal leave to use, personal illness leave to use. So that's 20 days. And there are 177 school days. And so that's more than 10% of the school days that individual may, am I right, Linda? Yeah, I know it's minutes. We all hear that Rent song in our mind, 75,600 minutes. But yeah, effectively, it usually is around 177, although we may have a few more days this year. But my point being is that you're talking about 10% of the workday or of the work days in a year, and that's quite a bit, just quite candidly. And then if an individual were to have a prolonged illness, because there are people who are going to get ill other than COVID.
Right.
And so a prolonged illness and you're unable to report to duty, there's family medical leave, which then can grow into temporary disability if you are still unable to report and you have a personal illness. And so there are plans in place, and I will not, spoiler alert, but I will tell you Dr. Henry has advised Ms. Franklin and I, who have worked very closely on all this leave stuff along with Dr. Deb. He has said if we come to December and it's not better. If the federal government doesn't, extend it, then I'm going to come back to this board. And if we need to ask for 5 more days of local sick leave for our staff for the spring, we're prepared to do that.
Absolutely. Thank you so much for that in-depth answer because a lot of our employees are concerned about that, and I think they will find that gives them some level of comfort to know that. And I guess question: do we have any feedback from I know we haven't done our survey of staff yet, but do we have any kind of feedback from our campus principals, what their feel is about teachers who are comfortable returning versus those that are not?
I don't think we have that data. And again, I think it was difficult to submit a staff survey until staff understood the protocols and procedures that we had in place or planning to put in place. And we wanted to make certain that before they completed a survey, they kind of had a better picture of what it's going to look like and what's remote learning going to look like, what's in-person instruction going to look like. So we're working on that now, Ms. Blackshear. And again, I think that a lot of conversations have occurred with the campus principals about really looking to not make this a divisive issue with our staff and trying to...
Nor do we want it to be.
Well, and to manage this and make this the best situation possible.
For everyone.
And so, there's just not a clear, easy answer. They're going to try to make the accommodations and make this a win-win for everyone.
Good.
Ms. Blackshear, just very quickly to add to that, once we get the questionnaires back from the parents, we'll have a whole lot more information of what it's going to look like.
Right. And I just want to say I've heard from some teachers who taught summer school and have heard nothing but just great praise for the Schoology platform. So I'm excited that will be our virtual platform for the fall. And again, I thank all of you for all you have done, because there's no right or wrong answer, but I feel like your committee, Teresa, and I thank everyone who served on your committee, has come up with a lot of good solutions. So thank you.
Mr. Ryan, you're up.
Teresa has a great report, and I do take pride in the fact that our district takes campus safety and health seriously. We always have. I mean, that's one of our staples of our community, of our district. So I'm thrilled about that, and I'm also thrilled that our district waited because there's a lot of districts that are coming in and they're having to revamp what the plans that they've already made, and it's still mass chaos in some regards. But I just want to focus a little bit on the timeline, Teresa, on the return to school questionnaire. How are we submitting that to the parents? And then I'm sure we'll be doing it in multiple languages.
I'm going to let Paula, and then even if Ms. Francis needs to talk about how they're doing that. But Paula's team is organizing the questionnaire.
We are working with our informations team, and an email will go out to the parents. Parents are registered in our home access center, and an email will go out to each parent.
And then how are we going to reach maybe some of the people in our community who don't have internet access or don't have email, to make sure their voices are heard and they know what's taking place?
We are looking at a variety of options, and we haven't really, I think that's to be discussed. We had a meeting this morning, and we're going to have another meeting in the morning. The Schoology has been mentioned as well. Just trying to use both avenues to reach all parents.
And also at the campus level, because this will be live and real time. The campuses will be able to access their information, And we'll be working with the campus administration, because we have our campus administrators that are coming back on duty now, and they can start looking at that and identifying those that they need to like physically pick up the phone and call and reach out to. So just like we did in the spring, we're going to make every effort to make contact to determine which option those parents are selecting, because the campuses want that information just as badly as we do, because they need that for their planning purposes.
Right, and I know that I think Linda, when we were trying to reach students, we missed like 2 on the last big deal we did. So I just want the parents to be ready for what they're about to receive, actually, because then I just want to confirm. So by August 5th, if I said, hey, I want my kids to go back to school, then that's what I'm selecting by August 5th. And then if I change my mind, I have until the 25th to change my mind. Am I reading that correct?
You are correct.
Okay, and then if I select I want my kids to go to school, am I making that, and assuming they stay healthy the whole year, am I making that selection for a grading period or a semester?
I'm going to let Dr. Macias answer that. You know.
Thank you. Mr. Ryan, part of the guidance from the Texas Education Agency is that we can request for parents to commit for a grading period.
Okay.
And so for a grading period and then after that, they can choose to change to the other format. We do know, of course, that there are going to be anomaly situations that come up where our leaders will have to make a decision whether to go ahead and make that transition before the grading period. But the standard is going to be at a grading period.
Okay.
Don, just one of the great things about the new Lenovo tablets, the great thing is it's going to be very easy if someone becomes sick, and not necessarily COVID related, but they can immediately keep up with their schoolwork. We're really excited about that, not just for this year, but moving forward in the next several years. They're going to be able to transition kids much easier.
And I would finally, and this is, all my questions are over, but I would kind of echo what Tom said earlier, and that's for our parents and even our employees to have patience, because this stuff changes daily. I mean, literally, you can watch the news and see countywide where everything changes. But I applaud the fact that our administration has been extremely flexible, and I know that you guys are gonna bring to us the best decision that's in the best benefit for our students, our staff, and our community. And I'm very grateful for that. So thank you.
Thank you, Mr. Ryan. Dr. Ogletree.
Thank you. This is an excellent report, and Teresa, to you and all that worked on this, it really gives us a look at how comprehensive, how diligent, how concerned we are about our students and staff. And I want to also applaud our staff and parents for their concern and expressed concern over this situation. For anyone who would make light of COVID-19, shame on you. And this is not just about death. This is about sickness and suffering and long-term effects. And every staff member and every parent should be concerned about it. And so this is why we're going through this. What I'd like to ask the students who, parents who ask for option 2, they are going to be able to take advantage of band, choir, will there be special periods during the class day for that to take place?
Dr. Ogletree, at this time, the extracurricular activities like band or drill, those, our kids will be able to participate in those activities after school. So marching band after school or the drill team type activities after school.
Okay, right now, after school.
The after school activities.
Okay, all right.
If you're talking about like the band period or the athletic period, we'll have to figure that out, how to accommodate that, because let's just use volleyball and football. We just received notice today that there are plans for them to be able to resume competition in September. So I feel confident that those coaches, in order to prepare for that, would want some level of access to those students during those athletic periods. But that, depending on when that's scheduled on each campus, they may have to have flexibility in when they meet with those students or have them report. Because remember, in electives, certain elective courses can have the requirement for students to report on campus to engage in certain activities. So that would be an example of that. But we don't want the student, because of the schedule that the curriculum team is creating for virtual instruction, we don't want them to miss instructional time in a class coming back and forth through campus. So it's going to depend on when that class athletic period would be and how we can accommodate meeting with them. But after school practices, they would 100% be able to engage in.
And the fine arts classes, they will be able to participate in those fine art classes, and we can provide those in a remote manner.
Okay, all right. Thank you, thank you. On the safety, health and safety protocols, and I don't know if I heard this correctly, but are we going to be on the honor system as far as asking the questions, have you this, have you this, and especially relates to temperature. Will we actually take temperatures of staff members and students, or is it just
and I'm going to ask Dr. Bernal to kind of respond to the process of taking temps. The guidance, and I think Dr. Bernal supported that, did not recommend that we take temperatures of students, but I'll let you kind of speak to that.
That is correct. We have chosen not to take the temperatures of students or staff, basically because it would not catch any asymptomatic persons. And also if a person has taken any fever-reducing medications, of course, their temperature would appear normal, and then they would convert, to having a temperature later on in the day. So it is not productive time-wise to spend the time and the personnel on checking temperatures when fever is part of the symptoms, but it's not an overwhelmingly percentage. Paired that with the asymptomatic and the fever-reducing medications, it does not seem productive to take the temperatures.
And thank you, Doctor, because this really helps to highlight how peculiar this virus is. We also have to worry not just about asymptomatic, but also pre-symptomatic people who could spread this virus. So.
That's correct.
We've got our hands full with this situation. Thank you.
You're welcome.
Well, Tom has already asked the funding question. We're getting surveys of parents. I'm concerned about substitutes. and I don't, it's not really a funding question, Karen, but could we, because of this situation, have a lack of substitutes this year, people who fear going into the classroom?
Well, we've made contact with all of the subs that we had in our sub pool last year and asked them if they were going to reactivate and if they wanted to work. And so we have over 1,000 subs that have identified as, I do want to work. Could that change later on? By all means it could. We're even trying to increase our substitute pool to add more individuals into that pool so that we have a healthier pool of subs to be available for teachers. But we did specifically do a reactivation plan for our previous subs, and they have reactivated as an indicator that they do want to work.
And what is our normal pool for substitutes?
Our normal pool runs about 1,000 to 1,300 substitutes, active subs. And active means they're working about once a week. That's the flexibility of having a substitute. They can pick up jobs as their life allows them to. And so we run about 1,000 active substitutes a year.
And Sharita, another question that for you is under the Family First Coronavirus Response Act, it says that one of the qualifying reasons is caring for his or her child or school of a child where the school is closed. Yes. But it doesn't cover if the child has COVID.
So that would fall under reason number 4. So caring for an individual, and under the definition of individual, that child would fall under that category.
Okay. Spouse too?
Yes.
Good. Okay. All right. Let's see, I thought I had another one for you. The employee, and I don't know if Teresa may have covered this because I was looking at the chart. Everything seemed to work. I think Debbie asked these questions for the staff member that has to take leave, but the employee who worked with another employee that has been diagnosed, if that employee if it is deemed that that employee has to quarantine, how does the administrative leave affect that employee?
So if the employee is in the contact tracing pathway because they've been identified as being exposed to someone at CFISD that has COVID, they then would contact their supervisor and then contact human resources. There's going to be a leave provision as if they would go in and put in a sick day. We're going to be able to have an identification to be able to put in a designation for that employee so that we can process that the same way.
We have, this is maybe to the doctor, we have nurses, right?
Correct.
But do we have adequate supply of PPE?
Yes, we have, like Ms. Hall mentioned earlier, we have 92 nurses, the registered nurses at each campus. We also have 54 clinic assistants that assist the nurses that are trained in clinic operations, first aid, medication administration, all the basic clinic procedures. And we have 4 LVNs that float throughout the district to help with certain events, to fill vacancies, to fill absences, that sort of thing. We also work with a staffing agency that takes care of special needs children, and we are working with them to help us fill vacancies over the next couple of semesters as we see an increase in absences. We have stockpiled as much PPE as we can find, and we are in the process with the budget year having just opened July 1st. We're in the process of procuring more, and I feel very confident that we have appropriate PPE to protect our staff.
Okay, okay. Thank you.
You're welcome.
Dr. Henry, I'm one that believes, and I pray that it's not going to be like that, but I do believe that we are looking for a big surge in the fall semester with this, and that's why I was asking these type of questions. You mentioned earlier that we should contact our Congress people about some funding, but I think we should also write to our governor and lieutenant governor because we have rainy day funds that they have released, and we never did get the $5 billion that they took from school funding. And this will be a good time to, you want kids to go back to school, to pay up.
Ms. Heineman.
Yes. Thank you. Thank you, Teresa, and everyone on the administrative leadership team for the excellent report and information. All your time and energy and efforts is very much appreciated. I also appreciate the fact that on the Return to School Committee that it included teachers, parents, and students, because those voices are critical in order for us to go back to school safely, whether it's in the classroom or remotely. So I appreciate having those voices represented. I think it's also, you've heard from all these questions, and we've all been contacted by community members. There's just an intense need for communication. So I hope that today is the beginning of just a tidal wave of communication and access to information for the community, because I think that will go a long ways to easing the anxiety and the stress that we are all feeling as we prepare to start back up at school. I have a couple of questions. Most of my questions have been already asked by my colleagues, and I appreciate that. Under the, and this is a very detailed question, the semester exam exemption eligibility statement, we've received feedback from parents and from staff members in the past about, in the past, when you had to go to school to get your exam exemptions, sometimes kiddos would go to school sick. What I heard today was, if you are not feeling well, whether it's the coronavirus or it is just whatever it may be, you are encouraged to stay home and to do your learning that day through the Connect, CFISD Connect, correct?
That's correct.
So, and is the exemption still 3 days? You can, if you need to.
Attendance no more than 3 days in one class.
Absent, right.
Absent.
But now, the need to be absent, counted absent, is much less likely because now students can access their classwork and their schoolwork from home.
Yes.
Okay. And I'm assuming there'll be some sort of way for the student to let the teacher know, hey, just letting you know I'm staying home, I'm not feeling well, I'm staying home today, but I'll be participating online. And they will.
That's a great question, and that's a detail we haven't worked out, but absolutely
Minor.
would have to establish a process
Some
for that.
communication, so the teacher knows, oh, they're not here today in my classroom, but they're going to be checking in online.
Correct.
Okay. Under mitigation, face masks, we said we would make masks available to students who need them, but students are allowed to wear any mask that they choose to bring themselves from home. Is that correct?
Correct, as long as it complies with the student code of conduct and dress code.
Yes. What about face shields?
Yes. In our definition that will be released, we give a description of how we define a face mask, and that does include a face shield. So
Okay,
great
good.
question.
And under PPE supplies we're providing to our staff, that will also include face masks, face shields, et cetera. Is that correct?
Yes, and I can have Mr. Powell come up, and if he doesn't have that number with him, here I
don't need a
can
number,
hand it
just
to
yes,
you.
the PPE will be provided to staff, and that would include face shields if they would like one? Yes, ma'am. Okay, yes, the answer was yes? Okay.
Yes.
Thank you. Under mitigation, student-teacher groupings, I appreciate that we have to wait until the feedback, the results from parents letting us know how many kiddos to expect in the classroom. I expect that will definitely change after the first 9 weeks, so there'll be some constantly reorganizing and structuring of classrooms based upon how many kiddos show up the first 9 weeks, and then that would change the second 9 weeks, correct? Yes. So lots of
Yes.
flexibility. Yes. Okay, I'm trying to get through this. Under mitigation, again, visitors, I support the limitation of visitors on campuses while we're trying to maintain health and safety protocols. I encourage that when we do feel like we can start to open up, that we look to bringing our mentors back on campus as quickly as possible. I really miss my kids. I miss the kids that we mentor, that we haven't seen since March.
And I agree with that. And we haven't had much discussion about this, but we may even be able to set up some virtual interactions.
Because we're not allowed, we don't know how they're doing.
Correct.
I will say one of my kids that I mentored 2 years ago did reach out to me, because they can track you down. Kids can find you and reach out to you. And she did reach out to me, and she just said, "Miss Julie, I miss you. When can we go back to school?"
And I
really
appreciate
just meant
you
a lot.
sharing that.
Yeah, I miss her too. Clinic, mitigation, under mitigation, clinic. We are very blessed to have nurses on all of our campuses. Many districts do not have school nurses on each campus. We're very blessed. And those folks are amazing people who serve our students and staff. If we need substitute nurses, do we have a process for accessing substitute nurses? Dr. Bernal?
Yes, we have a list of regular subs that we have been using for the last few years. That we've reached out to, and they're available again to us this year.
Okay.
And we're also contracting with a staffing agency, should that not be sufficient, so we can make sure that we plug those holes.
And then in just the course of my week last week, I got to meet with, or I got to interact with a school employee, actually from another district, but a big concern of hers was access to testing. So do we have any way where we can, I know we don't do testing ourselves as a school district, can we make an arrangement with either the county or with another organization that could provide quick, easy access to testing with fast results? The concern is if they have to go get their own testing, you struggle with trying to find an appointment, get in the test, wait 5 to 9 days. Could we be a part of that solution?
I understand that that's an issue, and we've definitely talked about this at great length, but the truth of the matter is a negative test today does not protect you from COVID tomorrow. So I don't really like to rely too much on the test results, because the symptom-based strategy, I think, is a much better indicator of what is going on than the test. Like I said, within the 14-day incubation period, a negative test can easily convert to positive. And on the other end of the spectrum, a positive test can last much longer than the symptoms actually do last, than the infectious period lasts. We've seen cases where individuals have tested up to 3 months. They've still tested positive, but they're no longer infectious. It's just due to the viral shedding. So the test, I'm not a big proponent of it, I'm sorry.
Well, and I appreciate your opinion. You're the medical health expert for us and for our district. I just am sharing that there's the sense that people within our community, whether they're staff, employees, or parents, or students, I wish as a community, I'll say, we had easier access to testing.
Definitely, we can look into finding, coming up with a list of resources where people can go and get tested. If you check on readyharris.org,
Yes.
for instance, you can find testing there. We've had testing at Pridgeon Stadium.
Right.
And I can certainly work with the health department to make sure that we have easy access and quick access to testing if that's desired.
Thank you. I appreciate that.
You're welcome.
Teresa, on the flow chart for students under reopening this.
Okay, come back, Dr. Bernal.
Sorry, Dr. Bernal.
I thought you were talking to Teresa. Sorry.
Oh, no, it was for, it's for Teresa.
But okay.
The flow chart. No, this has nothing to do with that. It has to
Okay.
do with just a suggestion to add a box. When a student is leaving the classroom, let's add that they're going to connect remotely. Do you know what I'm saying? You don't think that needs to be there? Okay, I'll talk to you about it later. Okay. Okay. Under social emotional well-being, last year we had a mental health expo where we invited community resources for mental health to come to the Berry Center, and it was open to staff and to parents. And the mental health department, guidance and counseling departments have done a fantastic job on Facebook, doing Facebook Live events with different providers during the last several months. Have been just incredibly helpful on Facebook. I would encourage us to also find a way to consolidate that information and make that resource available online, so if a parent feels that they need some support, it's very easy to access who are the service providers in our community. I haven't seen it, so if that's something we could put on our website.
Absolutely. And
I think that would be helpful.
Share that with Mr. Sampson and Dr. Schluter.
Thank you. I'm almost done. My last question is related to federal funding, and it's been touched on a little bit. We know that the federal government did send some emergency funding to the state of Texas to be distributed to school districts in our state. That funding that was sent to school districts, the amount of that was cut from our state funding, so the net result was zero. We did not get additional funding to deal with the cost associated with COVID-19. Is Cyfair ISD in line for any additional federal funding, Karen, to help offset COVID-19 costs?
Yes, you're correct about the CARES funding. Basically what happened is they utilized the CARES funding that the state received, and they are actually taking that amount and reducing our ADA or our state aid by that amount to offset it. TEA has said the reason they did that is because they know that the next year is going to be a challenge because of the loss of sales taxes and oil and gas taxes, which is one of the biggest ways they fund public education. Therefore, they were hoping by not having to put that state aid, I guess you could say, portion in this year, it would minimize the need in 2021 to be able to have to cut funding because of this. We will also, there is some money, there's a little bit of FEMA money, but it's Category B, and that Category B is emergency protective measures, and it actually is very limited to cleaning of our facilities to get them ready for for kids to return to school and employees to return to work. And then possibly a little bit of personal protective equipment, possibly, but there's just not a lot. FEMA won't cover a lot. There is also the Coronavirus Relief Fund that came in that's coming through TEA, and it's to reimburse expenditures between March 13th and May 20th. And we can get up to $250 per compensatory education student. Now what they'll do is they'll take everybody's request in, and then if it's more than the amount of money they allotted, they're going to scale us back. So that's a possibility. That money is limited on what we can utilize it for. So for example, we could all the printing of the packets that we've been doing, possibly Schoology, the cost of Schoology, some of that stuff, we could actually maybe apply for that money. We would get reimbursed up to 75%.
Thank you. I would encourage us, I know you will, apply for every bit of extra funding that we can get. And then I would mirror what Dr. Ogletree said, and Dr. Henry, that we reach out to our elected officials and ask them to keep their promises to fund public education, and that when dollars are allocated to school districts, that they actually do provide those to the school districts rather than keeping it for themselves to pay bills that they have at the state level. Thank you.
Thanks, Ms. Heineman. Mr. Jackson had a couple more questions. Mr. Jackson?
Thank you, Bob. We touched on this at a prior board meeting, but I think it makes sense to go over one more time. Teresa, you mentioned that we will be doing deep cleaning of the rooms. What exactly does deep cleaning mean?
I'm going to let Mr. Morgan come up and answer that.
Saving a trip. No, actually, that's an excellent question. We'll be disinfecting with hospital-grade quaternary ammonia every night with the operations crew. Then for every classroom, they'll be given a combination of spray bottles with 70% alcohol sanitizing solution, wipes, and paper towels, so that throughout the class day, teachers or however the principals decide where they're going to clean the desk, whether it's going to be the teacher or the student, can wipe the desk before and after instruction. And then again, at night, we'll come in and disinfect the entire school.
And so the key point is that we are cleaning to a hospital standard.
Hospital-grade cleaners, yes, sir, disinfectants.
And we actually went to that some 9 years ago when there was an infection outbreak that we had, and that was a tremendous step up.
Yes, sir.
I presume that we have funding available if we needed to go to acquire the equipment for the fogging.
We have foggers. We've been investing in foggers since the spring. The operations crew has done a fantastic job. They've got adequate supplies. They've invested in additional equipment. So we've been working with athletics. We did a lot of fogging when we were doing this for athletics, for graduation. So we're prepared.
And you mentioned that the fogging is also available on buses. Is that
yes,
correct?
Sir.
Excellent. Thank you, Matt. Appreciate it. And Matt, I love props, right? You got to have props.
Just demonstrating. So
Demonstrations. Yes, excellent.
You missed the sign. I missed the what?
Linda, quick question for you. We touched on this at the last board meeting, but I think it's important to touch again. We do have enough digital licenses for every student. And what about for our class sets? For some of our textbooks, do we have the flexibility either for those textbooks to go home with the child or to acquire digital licenses, particularly for some of our specialized classes?
Mr. Jackson, we have done a thorough research to make sure that we're covered with all of our classes. And actually, with the exception of probably maybe 4, it's very few classes where we have a textbook, there is a digital version of that. I also want to just remind you that our textbooks are resources for us. We do not use them as like chapter 1, teach chapter 1 or chapter 2. They are a resource for us. Some of those classes that do not have a textbook assigned to it are more classes that are more current event type classes, and then the teachers are providing the curriculum for those classes as well.
So the bottom line is we are prepared either digitally or in hard copy.
Yes.
For each of our classes. The other question, I'm going to ask you to address this when you talk about your recommendation on the change of the calendar. Once again, you covered this twice before in board meetings, but I think it makes sense to touch one more time. Both you and Dr. Henry addressed closing the gap that occurred this springtime and the fact that this gap may continue for a while You have plans put in place, but when you talk about the calendar, I would like for you to touch very briefly on that again for us.
I will.
Thank you, Linda.
Okay. Really great questions, board, and sadly I crossed out all of mine as y'all asked each one of them. And all of them were excellent questions. I know Teresa mentioned it, so I really thought well, I'll tell you that. I do have a couple of extra questions. Under the CFISD Connect, Dr. Macias, and I'm sorry you sat back down, but I remember you making a comment back in the spring, toward the end of the spring, as y'all were taking a look at Schoolology, I think, for the summer, and then you were looking at what we're going to be doing in the fall, that our fall activities were going to be a lot different than what we saw in the spring. And I've heard parents that have somewhat complained they didn't feel like their kids were getting enough education during the spring. So when you talk about teacher-directed lessons and activities, I don't want you to go into great detail, but there is a big change in what we did in the spring and what we're doing now.
Absolutely, absolutely. What our students will be receiving, what our parents will be seeing is two-way, real-time, live virtual instruction with the teacher teaching every day, along with teacher-directed lessons, activities, learning type activities. The teacher will be there every day.
Okay. And that was one question. Before you sit down, I noticed that there's 55,000 devices we'll be getting through the fall of 2020. So what are we going to do for the students that are not going to have a device when we start back to school? Is there something special we're doing with them?
First of all, we're hoping that with, I'm sorry? Oh. Yes. First of all, we are hoping that if you approve the revised calendar starting after Labor Day, we're hoping that we will be able to get more devices out there. But in the event that we have students who do not have a device, then we will start with some packets, just like we did in the fall, as a transition. So the packets will just be while we are getting the instructional tool and the internet service for our students. It's not the solution. It is a transition.
And the book, I just went blank on what they're called. I'm sorry. Thank you. Chromebooks that we're getting. If you're a family and you've got 3 kids that are in school, you're getting one for each of those children. Isn't that correct? I'm sorry. Wrong person up?
Yes, sir, that is correct. In the spring and over the summer, we initially began with household surveys to address the need, and with this new program, it will be a device per student.
Okay, all right. That's I appreciate that. Thank you. A question. I know at one time during the past few months we talked about possibility of box lunches in our cafeterias. Is that still on the table, or is that something that we have decided we're not going to do?
It's definitely on the table just to help speed up the process of serving all the students.
Okay, all right. I had not heard that during the report, so that's why I was asking. Thank you very much.
You're welcome.
And I want to commend y'all, number one, in saying that we have counseling sessions for staff too. Thank you for doing that, because I know staff needs that. Boy, you're really working hard out there, aren't you? Did you realize when you took the job that you were going to be doing it? Really?
Other duties. Yeah, other duties as assigned by the general counsel.
Okay, my final question is, if a teacher comes in as an asymptomatic and they need to go home because of whatever happened in the classroom, can they still work from home during that time period?
Well, we do not have in our setting, we do not have telework if that's what you're asking, but if an employee is assigned to duty at home, anytime they're assigned to duty at home, they are to be available to perform duties or directions at the election of the supervisor. So depending upon the circumstance, if someone is in the contact tracing path and they're put on administrative leave pending resolution of the self-isolation period, then yes, they're on duty.
Okay.
They're just on duty at home. I hope that answered your question.
Okay, yeah, that's good. I just had a question. Thank you. All right, that's all the questions I have. I just want the community to know, whoever's listening in, that we on the board do listen, and I hope you've realized that listening to the questions that have been asked today, because all of them have gotten emails from community members, friends, family members, people maybe we don't even know, neighborhoods. And the overriding goal of this board is always the education of our students, but we're always keeping safety and security as the utmost point. So I want everybody to realize that we've asked for your patience, and your patience is what we need, and that's what we need throughout the school district. I appreciate all the input that we've got, and now I'm looking forward to seeing what kind of results we get when we send out the surveys. Okay, we're moving on to action items 3A. The board will consider modifying the 2020-2021 approved instructional calendar to help minimize instructional disruptions and adjust for learning loss in the event of a future closure as a result of the COVID-19 pandemic. Presenter is Dr. Macias.
Thank you. As you've already heard through several people today, we continue to receive guidance from the Texas Education Agency regarding instructional options for our students and how they may work. And right along the way, we've continued to look at the adopted instructional calendar to see if it is still meeting the needs of our students and our instructional team to be able to provide the instruction for our students. You may recall the last time that I spoke to you in June about the instructional calendar, that we added 15 minutes to the instructional day, which equated to 6 additional days of instruction plus the 2 additional days that we typically have for inclement weather days, for a total of 8 days for weather that could be used in case we had a spike in the coronavirus and we had to close either the school or the district for some days. And this slide is actually one that I used last time, which is what the commissioner was sharing. Pay attention to possible disruptions, minimize disruption. So make sure you build that into your calendar. And that's why we looked at adding those extra minutes that equal the 8 instructional days. Next one. So since then, as you've heard, we now know that our parents can choose whether they want their students on campus receiving instruction or whether they would prefer the remote learning, our CFISD Connect. And we also know, as you heard from Ms. Hall, that whenever there's a school closure or a district closure, that we can transition to remote learning and not lose any instructional time for our students. So those 8 days that we had talked about actually will take care of themselves as we're able to just transition to our instructional remote learning. When I visit with you in August, as we're completing our plan that we need your approval for and we'll submit to the state, you're going to see that the virtual plan, the CFISD Connect, and the classroom schedule very much mirror each other. And so it will be a much easier transition to go between the remote learning or back into the classroom as well. Go ahead and click. So you may recall that I talked to you about the 6 different areas that the commissioner had talked about, making sure that we were including in our calendar to address different components that have arisen as a result of the coronavirus. So go ahead and click twice, please. So So you see that where I've got the mark there, the minimizing the disruptions or the extra days, that's going to hopefully take care of itself as we're able to transition the kids from in-class instruction to remote instruction if we have any type of closure. You'll see as I walk you through the proposed calendar that the other 4 areas there, the adjusting for learning loss, providing time for remediation, dedicated learning time focus on struggling students, and opportunity to minimize the instructional or the summer slide are still a part of our calendar. We can still achieve with the calendar that we are proposing. So at your areas, you have 2 calendars. You have one that says proposed, and then you have the current adopted calendar, just so you can see side by side as I walk you through this. So as you've already heard, the first day of instruction that we are proposing will be September 8th instead of August 24th. By pushing this back a little bit, it's going to allow us to be able to get those devices out there, a little extra time built in to get the devices and the internet out there for our students. But you also heard from some of our speakers today regarding needing more training for digital instruction. That's going to allow us to do that as well. November 2nd and November 3rd were listed as professional development days for our teachers, student holidays for our kids. Those days would now become instructional days. Also, January 4th in our currently adopted calendar is listed as a professional development day, and that would become an instructional day as well. So if you look down to May, you will notice that in the old calendar, the last day of instruction for kids was the 27th, and the 28th was the teacher professional day, that closing out. And so now that moves over to June 3rd as our last day of instruction for students, and the 4th is that last day, that professional day and closing out day for our teachers. If you go up to August, you will see that there are more professional development days for our teachers. And I will remind you that our student time is in minutes, but our teacher time is in days, 187 days. So we have built in the extra days up in the front to be able to provide quality professional development in the area of not just continuous Schoology training, but also just how you teach in a virtual environment. Every single teacher needs this, because even if a teacher is identified by the campus as a face-to-face teacher, at some point they may become a remote learning teacher if the entire district or the school is asked to close. And so we would be proposing, or our plan is that the week of the 17th would be our district staff development day. So we would be providing virtual training for our teachers. The 14th is there as a day where they will also provide some training. Actually, Marnie will be providing some training on that day, and then it'll be a time to kind of start getting reacclimated to being at the campus. And then the next week is the district staff development day, and then the last 2 weeks would be professional development days, but they are all at the campus. So they're getting training on the safety piece, the security piece, all of those pieces that Ms. Hall spoke about. They'll be getting training in that, and then getting ready for students to come back to school either in class, face-to-face, or in our Connect CFISD. You'll notice that we left the starred green for the rest of June, And we did that just in case we might need to pick up some additional days for instruction for whatever reason. The guidance that we received from the state says that we can transition to remote instruction, face-to-face remote instruction for any coronavirus incident. But that's it. So if there's a hurricane or just some type of extended disaster, we cannot transition from the face-to-face to the remote instruction. It is specifically for coronavirus type situations. With this calendar, we have a total of 76,500 minutes. So you recall that the minutes are calculated based on the number of days times the number of minutes per day. We've kept the 450 minutes per day of instruction. And then any PD days, personal development days, are added in there. With this calendar, there's actually one professional development day between the first day of instruction and the last day of instruction. When we add that together, we have 76,500 minutes. That's actually 900 more minutes than we actually need. Remember, the magic number is 75,600. So this calendar is very much in line with calendars that we've brought to you in the past, where we have our minutes that we need, the 75,600, plus we have 2 more days that we build in there, we embed in there. In case we have an inclement weather day, we don't have to go back and make it up. It's already in there. So it very much lines up to the calendars that we've had in the past. Go ahead. So you may remember this slide also from the last presentation. So again, here are those 6 components, and you can see again that we are able to fulfill all those areas that we've spoken about. The minimizing the disruptions and the extra days or weeks because of the coronavirus. We're hoping that we're able to take care of that by transitioning our kids from in-class instruction to the Connect CFISD. All of the other components there, we've left the additional minutes in there that we added to the calendar. And so, Mr. Jackson, to your question, we have continued to build 30 minutes of support for our kids, where they will be working on the gaps that have been caused as a result of the coronavirus, remediation type activities, and then also focusing on our struggling kids. This 30 minutes of additional support, even in our remote learning and our Connect CFISD, you're going to see that is built into the schedule, because we know that we need to provide that additional support for kids, and it's going to be more personalized support, what they exactly need to be able to close those gaps. I think that was my last slide. If you have any questions, I will be happy to answer them.
Just to add one comment there that you may be curious about. With this calendar, if the board approves it, graduations would be June 2nd, 3rd, 4th, and 5th. There would be 2 on the 2nd, 2 on the 3rd, 4 on the 5th, and 4 on the 5th. 4 on the 4th and 4 on the 5th, as things stand right now.
Okay, Ms. Heineman, do you have any questions?
No, I don't think I have any questions. The only slight concern is that we lost our day off for Election Day. Are schools still going to be used as polling sites, as far as we know, from the county?
Yes, and we had a discussion about that, Ms. Heineman, and because we anticipate that we're going to have parents who are choosing the CFIC Connect, the remote instruction, we will not have all of our kids on the campus. So it'll be a better opportunity for us to manage any interactions or any visitors to the campus.
So we can still carve out a space for the county to set up their polling machines for Election Day from 7 to 7.
Yes.
Okay.
And I would say, Ms. Heineman, under ordinary circumstances, assuming we have that in 21-22, we'll add those days back in.
Okay, good.
Yeah.
Thank you. I appreciate that. Thank you.
Dr. Ogletree?
One question, Linda, during the staff development time in August, if a teacher has a fear or some trepidation of being in the classroom with students, can that teacher opt or ask or apply or request to be a virtual teacher? Who decides who's going to be virtual?
Well, Dr. O, as I shared earlier, and I apologize if I wasn't more clear, and I think Sharita and maybe someone else answered. So when we offer the virtual instruction for students, and then through CFISD Connect, that instruction will be delivered from the campus. It's not that teachers will, oh, okay, I'm sorry.
I knew it was going to be delivered from the campus.
Correct.
But is
The teacher will be at the campus.
instruction going to be delivered from a campus and with a classroom full of students? Or will it,
Okay, so you're asking.
There are two different things. There are teachers who will be teaching with students, and then the virtual teachers will be at the school, but in front of a camera. But if that's correct.
And I think they will be, I think that the campuses are making that decision based on the number of students. That could be possible, or it could be that they're teaching a hybrid, like some of the kids in their class are virtual and some are in person. Okay, sorry, maybe I misunderstood.
Did that answer your question?
We'll wait and see what's going to happen.
I think if you're asked, yes, if
in person with class, with students, and then there's the virtual.
yes, sir, that is correct. That is correct. So the instructional arrangements for our classes will be dependent on the number of students that select the face-to-face instruction or the virtual instruction, and then the campuses will decide which of the arrangements they have, whether they'll have a teacher teaching completely in the CFISD remote instruction, or whether we'll have a teacher teaching only face-to-face, or whether they'll have a teacher like we have in some cases right now, where the teacher is teaching face-to-face but has some of her students joining in or connecting in through Connect CFISD. They will be the students assigned to that teacher.
And maybe, and I'll just take just a minute to make sure, and maybe I'm now understanding better the question. I think it might be whether or not we are going to allow some teachers to teach from home. And right now, what I will tell you is that in any K through 12 setting, telework has not been, and nor do I see it in the future being a consistent modality for delivery of instruction. In the spring, you were talking about a very unique situation where everything was closed, and while staff, they were working from home, but they were truly not teleworking. What you're looking at, the platform that we are talking about is a lot of synchronous instruction. They're going to need the support of the campus, the materials, the smart boards. It is a much different dynamic. But as with any situation, if we have I guess I want to be clear. So if you have someone who is concerned, and like you said, they've got some fear, some intrepidation, that's why we want to have that additional time to work with them. How can I address that? And, whether it's the shields or the PPE that we provide, or maybe some modification or accommodations to some tangential duties, periphery duties. But, teaching is an essential function of a classroom teacher. And so that's not something that can be modified or accommodated away. However, if you have a teacher under the, legally that would need to take leave if they are unable to perform the essential functions of their job because of a health reason, then absolutely we will work with them through the leave entitlements.
Maybe I didn't make myself clear. Will all our teachers be trained to teach virtually?
Yes, sir.
Okay. I assumed that there were going to be some teachers who would not, who would be just strictly in-person teachers, and there will be some who would be trained to be virtual teachers. In fact, some probably would be better at it. So that's what I assumed. No teacher working from home coming to the classroom.
Yes.
And we're looking at a reduced population of students probably. So I was looking and thinking, but you all are clearing that up, that there would be some classrooms that would be empty or partially empty, and that classroom would be used for virtual instruction. And that, and what I asked is, could a teacher who's really concerned about this virus, could that teacher volunteer or ask to be a virtual teacher? But
That's a
no
campus-
one working from home. I wasn't asking about anybody staying at home. That's all I was asking.
Yes, sir, and so that'll be a campus decision based on numbers. And the reason why every teacher needs to be trained on the CFISD Connect, the remote instruction, is because even though they're designated possibly as only a face-to-face teacher, at any point, the state may say, everyone needs to close schools, or a campus may need to close, and then all of those teachers that are designated as face-to-face have to teach in the remote way. That's why everyone needs to be trained.
Thank you.
Thank you, Dr. Ogletree. Mr. Ryan, do you have anything?
No, I'm good.
Okay. Ms. Blackshear.
Just one observation, and I really wish we would have kept November 3rd, Election Day, as a student holiday this year, because to me it almost seems more important this year. I think while I know many people, if given the chance, will maybe vote by ballot, I think there could be a heavy turnout due to the election this year, and not being able to control who's coming into the school and who might come in and vote, even though they may be exhibiting symptoms just because they want to make sure their vote counts. I would have preferred to see us take that holiday and end school on June the 4th and the Teacher Professional Day be on June 8th. I know that probably wouldn't be desirable maybe with staff, but I just do have concerns about people coming into our schools to vote.
And Ms. Blackshear, that is as a board, that is your decision whether we list November 3rd as a student holiday and a teacher professional days. It doesn't change when school ends or when the last day of instruction is, because remember, the professional development days, the times are added to the student minutes, and that's how we generate at least the 75,600. So that's your decision as a board.
Okay, well, it is something I would really prefer that we look at, is having school closed on Election Day. I just think there's some risk, could be a lot of risk there.
Thank you, Mr. Jackson.
Just to summarize, Linda, you're asking us to change and to postpone the start date for two reasons. One, to front-end load more professional development, particularly from a digital perspective on the new software. And then secondly, to allow additional time for devices to come in, for us to be able to get those devices out to the students who need them. Is my understanding correct?
Those are certainly two positive aspects of waiting until September 8th to start school.
I certainly like that thinking. Debbie, I would say that on Election Day, I would support that concept. I think the school can protect our students, but I do think there will be a perception among our parents that we've added risk. But having been through that before, I'm confident our principals have it well in hand. But if the board wanted to move in that route, I would certainly support it.
Well done, everybody here. I totally support being closed on Election Day. This is a national election. It's not a local election. I would 100% ask for the board to keep Election Day off limits for the kids and stuff. So.
Okay, Marty, I have a question for you. I'm sorry.
No. Just, you asked. I have one more question after you go. You go.
My question for you, Marty, and this is I'm not sure how to proceed exactly. So if we want to amend the proposed calendar, do we do that motion first and then the calendar? Or do we do it all at one time?
Well, technically, with any item, we would make the motion first and then have the discussion. So, and I was actually even saying, I mean, we do that sometimes, and I don't, although I felt like I had talked too much with Dr. Ho, so I was just sitting here. But technically, yes, that's why the confusion is coming in, is because technically you have a motion on the floor, and then once the body owns the motion, then you have the conversation on the motion, and then you can make a friendly amendment to the motion. But, so that's Robert's Rules of Order. That's not the Open Meetings Act. So there's really no, that happens with Robert's Rules of Order. It's just parliamentary procedure that helps the meeting go smoothly. So I would say at this point, if you were going to, you would just make the motion whatever you wanted it to be, and then you could have even further discussion on it.
Okay.
But that's just a parliamentary thing.
Thank you.
Mm-hmm.
Ms. Heineman, did you have another question?
I did, but do you want me to make the motion and then we can, or do we just go ahead and ask it?
Dr. Oldtree, did you have another question?
No, I was just going to make the motion.
Go ahead and make the motion,
Okay,
Dr. O.
so I'm asking, may I have a motion? I'm sorry.
Mr. President, I move the board approve the administration's recommendation to modify the 2020-2021 instructional calendar to help minimize instructional disruptions and adjust for learning loss in the event of future school closures as a result of the COVID-19 pandemic.
Thank you, John. Do I have a second?
Second.
And John? Now we're open for questions. There are concerns. Yes, ma'am.
No, go ahead with Julie.
Okay, I have two questions. One, and I apologize if I missed it. Under grading periods, that's blank. Are you going to be revising those?
We are. We just didn't, we didn't
have
get to
time.
those
Right.
fast enough.
In the last 24 hours, right?
Yes, but we will be revising them because with the changes, our number of days change. Remember, our minutes increase, number of days change. So we've got to go back in there and schedule those grading periods.
Okay, so that's coming. And then my second question is, what's also not on here is the days that will be devoted to STAR testing. I'm going to make a statement, but there is a lot of discussion in the community about STAR tests, and I would encourage parents and community members, when you are contacting your elected officials regarding funding, that you also add your thoughts on STAR tests and putting our children and teachers through that during such a challenging year. I'll just make that statement. Thank you.
And I'm going to comment on that, and people have asked me about that and asked me to make statements about that. I just can't believe that our state leaders are that blind to think in a year like this year to do STAR tests. So I think cooler and smarter heads are going to prevail, and we will not take those, and certainly they won't be used for any kind of accountability system. So
I hope that's correct. As of now, it's still on the calendar by
know
TEA,
that,
and it's still one of our requirements that we have to meet. So,
and we'll continue to work towards that. But
Thank you.
I just can't believe that people are that
by people, you mean
leaders of the state.
Thank you. The governor and the lieutenant governor and the TA commissioner. Thank you.
Are we voting on what's in front of us, or are we voting on what's in front of us with making the third?
A motion, no, there's not been an amendment yet.
Do we have to have an amendment? Because if we're just saying, all we're doing is saying to modify the calendar.
Marnie?
Well,
The motion's to modify the calendar, so either, if we keep the third or take the third, we're modifying the calendar.
Correct.
So do we have to have multiple motions, is my...
No,
I know, but that's what I'm saying. The motion is to modify the calendar, and whether we keep the third or take the third, we're modifying the calendar.
Yes, and typically when you say to modify the calendar, we've made a presentation, and there's been a presentation, or we've provided it, and lots of times we'll say in accordance with the administration's recommendations. So I think now we've got a motion to modify, and so then you would give direction to, as part of the discussion, to the superintendent how you want the calendar modified. And that it would be as, to delay the start date and to take to remove the November 2nd as a student holiday.
So if we sit here and discuss this, and we say, everyone goes, yeah, I'm great with making the third a holiday, then we give you that direction, and we just vote on this motion we got on the table.
Yes, sir.
Okay, there we go. That's what I'm getting at. Yeah, we're here, we're gonna vote.
Right.
I'm good with whatever. If we want to make that, as long as the first semester ends on the 18th, whatever.
We haven't, we haven't looked at when the semesters will end yet. We're just looking at the dates for the start dates and the PD days, because we've got to see, we have this calendar, the way it's written right now, has 169 days. And so it's going to be much heavier on the spring side than on the fall side. That's why we're in the process right now of looking at the dates and counting them. And so we're going to try to end the semester, that's what you're talking about, Mr. Ryan, on the 18th, but we've got to see where the time
Typically, though, because of dual credit courses, AP courses, and others at the secondary level, we do end going into the Christmas break.
Well, I wouldn't be in favor of making the third a holiday if it's going to extend the high school semester into the January. I'll tell you all that. I mean, I want that high school semester to end in December.
And you just have to remember, there are a lot of,
But COVID could do that for us anyway.
Right, and the fall semester is just always going to have fewer days in it than the spring semester because of the two winter holidays. So that is part of the reason, and as Dr. Macias presented this to us, that we looked at the second and the third. And part of the reason we added the second this year is just keep in mind that we did see low attendance when you have a holiday in the middle of the week. And part of the thought, as Dr. Macias said, is that with fewer students on campus, that we, as you said, principals, they've got it down, and it's even easier when you have fewer students to cordon off a part of it for election day. So such that really students are not, they don't, but they're not going to be interacting with the voters. So it's really a facility access issue, but that of course is up to the board.
It's something like 60-some days. I didn't bring it with me as I was counting in the first semester,
I got you.
Which is, not even, yeah.
So we don't have to decide on the third right now. We just got to decide on the start date right now.
No, I think that we need to decide on the third. Would you say, Martin, to adjust it? No?
Well, the board approves the calendar, and so you can delegate to the superintendent with the parameters that you've indicated, the ability to modify the calendar, but the board does approve the calendar, instructional calendar.
Well, we can go ahead and approve the calendar, and then once we get into the semester, if we want to amend it, we can have one of our meetings amend the calendar, right?
Well, I would disagree with that, Mr. Covey, just in as much as, once we print out what the calendar is, you can't really take a student holiday away, I don't think. I think we either decide we're going to do it or we're not.
I think we can, because with all the stuff, I might have COVID just from this agenda item.
Yeah, we have somewhere around 60 some days in the first semester. But we can end, if we could end it on the 18th, and we would just modify our curriculum and know that we have shorter grading periods. This is really at the secondary. At the elementary, they're all 9 weeks, but at the secondary, they're semesters.
So Linda, you are saying that we can end on the 18th, but we can also take the 3rd off?
We could figure it out.
Good. Okay.
Just to give you a comparison, okay? So the calendar that we presented, that we have adopted right now, has 172 days. The calendar that we're proposing right now, the way it is, has 169 days. So we're talking about a few days there that we are losing, and so we will adjust instruction.
Well, I'll say I'm really not in favor of having to adjust instructions, so I'll withdraw my concern.
Ms. Blackshear, I just wanted to kind of clarify on Election Day. Ideally, we would love for that to be a student holiday. You're absolutely right, and we do anticipate large voter turnout, hopefully. That's what we all want. But our campuses do an excellent job of trying to identify spaces in the building that really limit that access. Voters do not have access to our students or to our staff. They set up entry points into the polling site that are either directly from the outside of the building into that room, such as a gym, but they really have good security procedures in place. I know that the principals that are watching are saying, oh, please, please, but we can make that happen, and we can have a safe environment on our campus. And I do want to stress again, we anticipate a reduced number of students on campus that day, which definitely helps, but we can make that happen. I think the priority, what we saw as the priority of removing those as student holidays was just what Dr. Macias was saying about trying to increase the instructional time in that first semester, because it does, we all know that it's always a little unbalanced anyway, but with pushing back that school start date, we were losing additional time.
I understand, and like I said, I do not want to do anything to reduce instructional time in the semester.
Okay, well, we do have a motion and a second. We've had discussion. All in favor of the calendar as has been proposed, raise your right hand. And that's unanimous. Thank you. 3D, the board consider authorizing the superintendent to approve the purchase of desk and tabletop protective dividers through board-approved cooperatives at an amount not to exceed $3.75 million. Presenters are Matt Morgan, Roy Sprague, and Bill Powell.
Mr. President, I move that the board authorize the superintendent to approve the purchase of desk and tabletop protective dividers through board-approved cooperatives at an amount not to exceed $3.75 million.
Thank you, Don. Do I have a second?
I second.
Thank you, Debbie. Any discussions or concerns? All in favor, raise your right hand. Unanimous. Thank you. We are adjourned. No. What?
I thought we had the agenda, the approval of the
It says, thank you, we are adjourned on my script.
Yeah, didn't we have a purchase item?
We just did it.
Oh, we missed that. We were.
I'd like what they're drinking.
I was
Around up here for the
clarifying
board.
about what the final decision was on the calendar, because, because folks
Keep it
were
the same.
confused, so I
As
apologize.
presented.
It's okay. Probably Marty's fault.
Just ignore me.
Just wake me up for the important stuff.
Everybody be safe and secure.
Thank you.